We're going to start the class now. Let me just share the course outline. So my name is Zoran Jelicic. I'll be instructor for TCM Oncology, INT 710. So this course is part of our advanced course series, and it's 30 hours in duration. Course deals with knowledge and introduction into oncology as a clinical specialty in traditional Chinese medicine. So during this course, we're going to look at development oncology, the modern oncological treatments, which are really integrated medicine, because from 1950s on, TCM and Western medicine has integrated skills in treatment of cancer and tumors and other oncological pathologies. So our main book for this course is going to be from Dr. Li, Peiwen Li, Management of Cancer with Chinese Medicine. This is probably the premium book in English language, translated from oncology textbook from Beijing University of TCM. Dr. Li was a prominent oncologist in Sino-Japanese Friendship Hospital, and his book is probably the best we have. So we're going to use that book for our course. So since the book is about 110 megabytes, I will work with our academic office to see how we can upload this book on AmpEducator, because AmpEducator only allows files up to 50 megabytes. And so that can be available to you. So this course grading will be following. So it'll be 10% for attendance and 90% for final exam. And final exam is going to be based on the classes that we're covering from the Dr. Li book, Management of Cancer with Chinese Medicine. And it's an open book exam, as I mentioned before. So I will talk a little bit more about exam toward the end of the course, which is on October 18th. So today we're going to look at the introduction to oncological theory. We'll look at common acupuncture, herbs, and moxibustion therapies and therapeutic procedures in treatment of common side effects caused by a radiotherapy or radiation and chemotherapy, which is what we do mostly in the West. We rarely in the West, as a TCM practitioners and acupuncturists, treat cancer directly. We often treat it as an associated clinician, where oncologists will refer patient to us, or patient will come on their own to us, us being primary caregivers in Ontario. And so we will typically treat the patients who are already undergoing oncological treatments for some form of cancer or tumor, and they may be treated with hormonal therapy, with radiation, with chemotherapy, with surgery, right? And so next week, September 13th, we're going to look at treatment of complication commonly associated with the cancer. And then September 20th, we're actually looking at the most commonly encountered cancers for us as a clinicians outside of China, here in Ontario. So nasopharyngeal cancer, esophageal cancer will be covered in September 20th. September 27th, we'll cover breast cancer and lung cancer. October 4th, we'll cover liver, stomach, and colorectal cancer. October 11th, we'll cover ovarian and cervical cancer. October 18th, which is our last theory class, we'll cover bladder and prostate cancer. And on October 25th, we're going to have a final exam. Again, exam is going to be administered through AmpEducator. It's open book exam, and it's worth 90% of final grade. And I'll talk a little bit more about composition and nature of exam on October 18th to better prepare you for the exam. So that's our course lesson plan. So let's just switch for a second to the book. So this is our textbook, Management of Cancer with Chinese Medicine, from Dr. Li Peiwen. And this is a scanned version, so it's about 110 megabytes. I will try to upload this through our academic office on AmpEducator. I will use ebook version, which is protected with the password from publishers. So unfortunately, I couldn't share it. And that ebook comes like this. So it's exactly the same book, it's just not scanned. It's so that way you're going to have access to the same material I will be using in our classes. So we're going to briefly look to the origin and historical development of oncological theory and therapy in traditional Chinese medicine. So we know that the first clinical mentioning of basically oncological pathology, in this case tumors or Liu, is traced to tortoise shells from Shang Dynasty. And from that point on, physicians are commonly encountering masses and cancers and tumors, and they're slowly developing a clinical theory and practical approach to treat these. So as we fast forward to following future dynasties of Jin, Sui, and Tang Dynasty, at that time, acupuncture plays a significant role. It is added in additional herbology and moxibustion. And basically, acupuncture itself as a therapy is used for treatment of common side effects of the central oncological pathology. So these are often problems with swallowing, problems with vomiting, problems with breathing, and others. And so during that time, there are some additional writings on the breast tumors and tumors around the neck, right? And as we fast forward into Song and Qing dynasty, the sort of fairly busy part of development of Chinese medicine. Song was a renaissance in some way of Chinese medicine because one of the emperor was actually a physician himself. So during that time, all the theories that existed are firmed up and systematized, and herbal formulas are standardized as well. More of the skin cancers are added to the body of the knowledge, and psychological nature of the oncology is also addressed, especially patients who are at that point realizing that this may be a terminal. So they may be stuck in certain emotional dispositions such as anger, depression, guilt, even shame, feeling that somehow they're not they're not as normal as other people because they contracted this condition, right? So during that time, psychiatric treatment is also developed as a part of overall oncological treatment. So as we fast forward to modern times, and this is 1950s, we see that Chinese medicine is now integrating with Western or biomedicine in the treatment of oncology. So what is integrated is particularly surgical skills, imaging such as X-ray, ultrasound, MRI, CT scan, and Chinese medicine also firms up the theory of Sheng Qi or vital Qi. This becomes one of the central team in diagnosing patients. So basically, equivalent of the biomedical staging theory, when they stage you, for example, from stage 0 to stage 1, 2, 3, and stage 4 is often terminal one. So Chinese medicine develops its own theory in staging through observing of Sheng Qi or vital Qi. And so from that point on, from 1950s, the oncology is integrated modalities. And at least in China, where oncologists, TCM oncologists use a fair amount of Western theory, drugs, and therapeutic means, including imaging, on top of already very well developed Chinese therapies. So, so that would be a brief look at basically the history of oncology in Chinese medicine. So I'm going to just fast forward a little bit here. Just give me a second. And I just want to go to the end of chapter 2, where Dr. Pei Wen Li discusses basically the role of Chinese medicine in modern times in cancer treatment strategies. So he states emphatically that supporting vital qi or zheng qi and cultivating the root, the genetic strengths of the patient, is the basic principle for treating, namely tumors in TCM, and it has proven fairly clinically effective. However, he also states that practitioners should not work under illusion that Chinese herbal medicine alone can lead to full curative effect. For that to happen, they would need to have access to patient 24/7 and probably administer herbs between 2 and 6 times a day, which is problematic even for inpatient in a hospital because it costs time and money and stuff. And that's why it's not that Chinese herbal medicine cannot work. It's just that it takes being holistic. It takes more time than Western drugs, who are stronger but also more toxic, right? And so, so he advocates combination of using herbal medicine and other TCM therapies in conjunction with the stronger and faster acting Western medicine. So that way, the Chinese medicine assists the Western medicine therapies in faster acting, but at the same time, he helps reduce any side effects and invasiveness of the Western therapies. And so he also adds some of the points. He says that, for example, Rehmannia 6 Li Wei Dik 1-1 is really good to introduce as a initial herbal formula in precancerous pathological changes, because he helps moisturize and detox the tissue. Treatment of patients before surgical procedure and in nutrition, I must add, can help them recover faster after surgery. Basically, TCM therapies used before, during, and after radiation or radiotherapy and chemotherapy can significantly reduce toxicity and side effects and invasiveness of Western drugs. And in the later stages, basically the terminal stages where palliative care is, Chinese medicine can significantly, if used daily, improve the quality of life, which is then the focus, right? Additional therapies like diet therapy, exercise therapy like Qigong, Tai Chi, Chuan can play a significant role as well to provide patients with mobility, with better circulation, with psychological grounding, and so on. And so psychological therapy should be constantly emphasized, reminding patients to stay positive and focus on positive outcome, breathing, and so on, because once the patient spirals out of control emotionally, then that slows down the positive effect of other therapies as well. So this summary is very important, so we can gain basically a years of experience summarized in a chapter of this very known oncological specialist, right? So in chapter 3, we're going to deal with the role of Chinese medicine in dealing with the side effects of cancer treatment. But before we go there, I would like us to look at a couple of videos just to sort of build on the material that we already talked here briefly. So what I'll do is I'll post the links into the chat area, and you can, obviously this video is going to be recorded as a part of a class, but you can also access them later I curated these videos from the YouTube, so you can have them as a resources. So if you just give me a sec, I will put all of the links for these videos that we're going to watch today into the chat area, so it's available to you. Again, it will be also available as a part of the video recorded within the class itself. Okay. Just Here we go. So these are the 4 videos that we're going to have a look at today, if possible. There's a good chance that we're not going to be able to see all of them. That's why I'm putting all the links there. So let's have a look at our first video, which is probably the shortest of all of them, and discusses briefly through the experience of this Hong Kong-based TCM physician, a role of Chinese medicine in treatment of cancer.
癌症係香港嘅頭號殺手，好多人聞癌色變，又對佢一知半解，而錯過咗最佳嘅治療時機嘅。今日我哋請嚟徐海教授同你講一下中醫點樣治療癌症。徐教授你好啊，好多癌症病人咧都會選擇咧手術啦、放療啦、化療嚟治療嘅。咁中藥咧喺治療癌症方面有咩個人之處呢？
中醫藥治療腫瘤還是有很多優勢的，主要體現在3個方面。第一呢，就是腫瘤病人在接受西醫方法治療的時候，比如說西醫手術以後，還有化療期間、化療以後，電療期間、電療以後，還有標靶或者免疫治療期間，中醫藥呢都可以進行治療。這個時候的治療的主要目的就是緩解西醫所帶來的不良反應，改善臨床的生活質量，使患者呢能夠更好的耐受，比如說像化療、電療，還有免疫治療，也可以幫助患者完成整個治療計劃，可能帶來更好的治療效果。那麼在這個手術以後，中醫藥治療呢，還有可能預防腫瘤的復發。實際上很多腫瘤在它發生過程當中，它的原因、病因到底是什麼？西醫也好，中醫也好，有一些腫瘤還是沒有明確的原因的。但是中醫理論有獨到之處，他認為腫瘤的發生和人體自身的氣血、臟腑、經絡的功能是否正常有關。舉個簡單例子，比如說像香港，天氣潮濕，人在日常生活當中可能就會接觸到一些致癌因素。那麼在體內呢，雖然腫瘤經過手術切除了，但是這些致癌的因素到底還存不存在？那麼用中醫的方法來調理，使氣血臟腑功能旺盛，陰陽平衡，去除腫瘤在體內有可能存在的致癌因素，就有可能達到預防的目的。同樣道理，化療或者電療以後，或者標靶藥治療以後，病人腫瘤獲得了一定的臨床緩解，或者還沒有治好，那麼中醫藥治療呢，可以繼續鞏固療效，這是一大優勢。還有一大優勢呢，就是有可能在中醫治療的積極參與下，使病人的生存這個時間有所延長，這是第二優勢。第三個優勢呢，剛剛已經提到了，在西醫治療的時候，中醫藥參與有可能提高療效。
環顧我哋周圍嘅親朋戚友咧，好多人都係癌症嘅，點解咁多人有癌症嘅呢？
具體來說呢，環境的污染是一大因素。隨着社會的發展，汽車尾氣啦、空氣污濁啦，這些都可能是發生癌症的主要原因。那麼另外呢，從中醫的角度，認為個人的自身因素也是非常重要的。中醫強調，任何一種疾病，包括癌症，它的發病是有內因和外因的。外因就是剛剛提到的，跟環境因素有關。那麼內因呢，就跟個人的生活習慣，比如說像飲食習慣，有沒有經常會進食一些產生癌症的這些飲食，比如說像煎炸、燒烤、燻製的這些飲食，中醫認為不僅僅是中醫，西醫也是這樣認為，都有可能引發人體產生癌症。另外，個人的精神情緒、 中医是非常重视的。长期的精神紧张、情绪不好啊，比如说容易发怒啊，有的人性格比较内向，容易生闷气呀，这样都会导致体内的气血津液代谢障碍，那么就会产生一些中医所谓的病因，比如说像湿邪了、湿浊之邪了、淤血了、痰浊了，这些很有可能会有这样的疑问。那么这些湿邪怎么会导致癌症呢？实际上呢，中医所谓的这个湿邪，就是指人体内的脏腑功能，尤其是脾胃的功能，对津液、水分代谢的异常，那么产生体内的一些致病因素，中医称为像痰湿、痰饮、痰浊了。实际上呢，我们借用现代医学的细胞理论，那么细胞呢，它生活的环境是非常重要的。那么一旦它生活周围的环境出现了中医叫做湿浊痰饮，整个细胞生活的小环境就会发生变化，导致身体的功能失常，中医叫做气化失常，就会使一些致癌因素长期作用在局部，就有可能引起细胞的突变，中医叫气化失常。这是从脏腑功能或者是从中医的病因湿邪的角度。其实致癌因素还有很多，包括中医认为像睡眠不好、长期熬夜、不及时的睡眠，中医讲究叫做要早睡要早起。很多人呢，尤其是有一些脏腑气血功能不是很好的病人，一旦出现这种情况呢，就会使体内的脏腑功能出现异常，也会产生气化失常，那么也有可能产生癌症。所以呢，像饮食、情绪、睡眠都有直接的关联。实际上还有一个重要因素，就是有没有坚持运动。这个我把它称为人体健康或者防癌的4要素。其中运动呢也非常重要，使人体的气血运行畅顺，增进人体的代谢，一些湿浊秽浊的致病因素经过运动，气血运行旺盛以后，可以及时的排除在体外，那么就有可能起到一定的预防作用。所以这个癌症的发生，那么和这4点关系也非常密切。
癌症係現代醫學嘅稱呼嚟啊，咁喺中醫學概念入邊咧，有冇癌症呢個字嘅？
實際中醫幾千年以來就已經有了。最早呢，在這個甲骨文這個時候，在龜殼上就已經發現有瘤字，就是現在這個腫瘤的瘤。真正中醫稱為癌，是從宋代1000多年以前，宋代呢，像女性的現在稱乳腺癌，那個時候呢，就把它稱為炎。所謂炎呢，就是一個癌字去掉外邊的這個病字框，就是炎。後來就發展成癌這個字，所以中醫對惡性腫瘤包括癌症的認識歷史是比較久遠的。
咁中醫咧就用中藥治療呢個癌症咧，個效果好唔好嘅咧？
中醫治療癌症的效果呢，實際上前面我們已經提到了，中醫藥治療癌症有3個優勢，就是在西醫藥治療期間，改善患者的生活質量，減輕西醫藥治療所帶來的不良反應。第2個優勢呢，就中醫藥治療對於一些年紀比較大的、生長比較慢的腫瘤，可能會延長生命。第3個優勢，實際上呢，這一點中醫是有一定的弱勢，但也有一定的優勢。對於一些分化程度比較好的一些老年病人，腫瘤進展比較慢，活性不是很高的這樣的病人，靠純中醫藥治療呢，有可能獲得殺滅腫瘤的療效。但是呢，對一些進展比較快的、惡性度比較高的、分化程度比較差的，尤其是一些年齡比較輕的病人，中醫藥治療是有它的弱勢的，尤其在抑殺腫瘤方面，是很弱的。
癌症病人或者邊一類癌症病人咧，喺邊段時間或者時期咧去接受中醫治療效果係最好嘅咧？
这个呢内容比较多，一些癌症病人呢，在什么样的时间治疗呢？首先我们说第一点，那么实际上呢，现在在社会上也有不同的认识，一些癌症患者，包括家属，甚至一些医生，他们有的时候对中医药治疗肿瘤呢，会有一些看法，或者有一些不信任，对中医药治疗，尤其在西医治疗期间，会不会影响西医药的对肿瘤的治疗，甚至加重西医药的不良反应。从中医的角度呢，实际上在癌症早期治疗，比如说像手术一般早期癌症以手术为主，手术以后的中医药治疗就非常重要。它的主要治疗目的是什么呢？就是改善患者的体质状况，预防癌症的复发。对于一些不能手术的病人，可能他要接受化疗或者电疗或者标靶药治疗。那这样的病人呢，中医药呢在化疗期间也是可以吃的，但是很多医生或者是一些患者呢有疑问，他们不敢去吃，怕增加毒副反应或者影响治疗。这个到底如何来处理呢？从我们中医学的角度呢，认为呢，这个时候的辩证治疗呢，是可以避免中医药带来的这些刚才的一些疑问的产生。尤其强调呢，这个中医药治疗这个时候如何来用药，如何来服药非常重要。比如说病人在化疗期间，我们也用中医药来攻伐肿瘤，就是所谓的抗癌。这个时候西药抗癌，比如说在化疗，中药也抗癌，患者身体可能受不了。那这时候呢，我们肿瘤专科的医生呢，用中医药主要就辅助治疗，配合西医的这种化疗，包括标靶药治疗，包括电疗，主要就是减轻这些治疗的不良反应，想办法增进药物的代谢，那么也可能会提高疗效。那么在一些化疗或者电疗后，或者标靶药治疗后，那么进一步的中医药治疗，我们也叫后期的后续治疗或者巩固疗效。那么对进一步的治疗肿瘤会有帮助，同时也可以使化疗的病人尽早的恢复体质体能。因为我们知道化疗药呢，基本上都是有很多毒副反应的，会给患者的身体，尤其一些脏腑功能造成一定的影响。举个例子，像鼻咽癌，有一些需要化疗和电疗同时进行，那么病人治疗以后，他的像口干啦这一类的反应，那么远期的反应包括他的细颈征甚至有一些病人有颅底部的电疗，那么也会影响他的脑神经细胞的进一步的伤害到。这时候中医药治疗呢，可能就使这些症状发生的不要太严重，甚至得到改善。这样呢，积极的配合都是很好的。那么这是在一些治疗后。实际上治疗以后呢，有一些病人呢会出现免疫功能下降或者是胃口的问题了，睡眠不好了，中医药都可以起到改善的作用，这也是很好的参与的治疗的一种。
你建唔建議咧接受緊放療、化療、電療嘅病人咧，同時間一齊做呢個中藥嘅治療嘅咧？
從我個人的角度，我是建議的，而且我認為非常重要。剛才提到了減輕不良反應啦，提高療效啦，實際上可以幫助患者完成他的治療方案、治療計劃。
咁對啲癌症病人咧，平時日常嘅飲食習慣咧，有咩需要注意嘅咧？
在飲食上呢，這個問題非常好，非常重要。中醫認為呢，這個飲食是一個主要的致病因素，它是個雙刃劍。飲食吃得好，那它可以養護身體，增進健康。那麼飲食不恰當，就有可能導致疾病，包括癌症。剛才提到了強調的這個飲食的這個食量問題，那麼中醫最強調的就是適可 像孙思邈也讲，人要常有小饥，就是什么意思呢？不要吃得过饱，实际上7、8分饱。那么饮食要清淡多样化。现代社会呢，人们生活条件比较好，都喜欢美食。实际上，从现代科学的角度呢，一些美食的制作过程，尤其是高温泡制，就有可能产生一些致癌物质。像一些腌制的、熏制的，都会产生一些致癌物质。中医叫做肥甘厚腻，包括一些生冷的饮品，那么都要引起注意。所以饮食呢，在临床癌症的预防上非常重要。
咁你頭先講開呢個飲食需要注意嘅地方啦，而家好多坊間好多人認為咧食嘢太豐富咧就變咗養個腫瘤，所以變咗唔食嘢，甚至辟谷唔食嘢添。咁你點樣睇呢樣嘢咧？
實際普通百姓對生活知識，他們都是很豐富的，他們都認為也很重要的。是這樣的，因為腫瘤由惡性細胞所構成的，它自然也需要各種營養，所以腫瘤病人在進食期間一定要注意的，營養呢夠了就可以了，不要過分的進補。實際老百姓的認為很重要，過分的補就是補了腫瘤。很多患者在臨床上看診的時候會問到這個問題，那麼怎麼樣去吃，要不要補？有的甚至吃很多補養品。我是這樣回答他，你每天的營養夠了就可以了。中醫認為忌口是非常重要的，同樣營養你正常人體也會營養腫瘤細胞，這是不可避免的。
好多癌症患者咧，好多症狀嘅，例如頭痛啦、頭暈啦、作嘔作悶啦、周身乏力啦，甚至係便秘腹瀉嘅。咁中藥咧，你啲舒緩啲症狀方面咧，有冇啲比較拿手啲嘅地方嘅咧？
很多病人在患有腫瘤期間、治療期間，或者是接受治療以後，他的胃口都不好，那麼像食慾不振啊，像吃了就想嘔啊，或者看到了也不想吃啊，這個中醫藥調理是非常非常好的。一般經過辯證治療以後都會很快緩解。那麼中醫對治療比較不僅僅是中醫，尤其是一些現代醫學治療，像一些腫瘤的併發症，比如說像疼痛，這個治療有的時候比較棘手，尤其有一些晚期腫瘤壓迫神經，產生這種頑固持續性的劇烈的疼痛，即使用到嗎啡都很難完全緩解。但是中醫在這方面呢，單純靠中醫藥治療完全緩解呢，也很難做到，可以減輕，但有的時候和現代醫學的一些止痛方法、止痛藥聯合起來，效果非常好，甚至可以達到8成、9成的止痛效果，而且還可以減輕一些止痛藥所帶來的不良反應。舉個例子，像嗎啡用了以後，病人會頭暈、欲嘔，甚至腹脹、大便不暢，也不能完全止痛。這時候配合中醫藥辨證治療呢，可以很快的緩解症狀，止痛效果也會提高，甚至有個別患者還會反饋回來的意見，止痛藥的用量還可以逐漸減少。
咁癌症患者咧，除咗食中藥啦、注意飲食之外咧，平時生活上例如會唔會做啲運動啊，可以幫助到佢舒緩呢啲症狀嘅咧？可以的。
以病例來說，像有一些腫瘤病人精神很緊張，情緒很不好，因為這個病畢竟是很難治，得了這種病以後很難有一個好的情緒。我們會經常建議患者自身情緒的修養控制啦，另外堅持運動確實是可以舒緩的，而且堅持運動以後呢，這個氣血臟腑功能得到調整，他的飲食情況、睡眠情況啊都可以得到改善。但是我們會根據患者的病的輕重、年紀的大小，那麼體質的狀況，來建議一些適當的運動，都很好的。包括像中醫的或者我們華人的一些傳統運動，像太極啦、橬鈴氣功啦、八段錦啦，包括現代的一些運動，比如說像慢跑啦，都是一種很好的運動。
癌症患者接受化療期間咧，佢作嘔啦、作悶啦，有冇啲食療湯水去推介下嘅？
這個很重要的，尤其香港人是非常重視食療湯水的。我們在診症期間都會推薦，但是呢，都要根據患者的體質。在這裡推薦一些呢也可以，但是也希望在使用的時候要根據自身的體質。比如說有些患者在化療期間出現了惡心啊、嘔吐啊，甚至看到飲食都不想吃飯、厭油膩。那麼我們往往會讓他在煲湯水的時候說加一些生薑啦、陳皮啦，有腹脹的我們建議加一些像砂仁啦。在飲食的時候也主張他呢清淡一點，以蒸和煮為主，盡量呢不要去吃煎炸的這油膩難以消化的，更加不要吃生冷的。尤其有一些患者在這個化療期間很嚴重的惡心嘔吐，那西醫會給他一些止嘔藥，但是他不嘔了，但是看到東西呢他有飽脹感不想吃，我們都可以用食療的方法。因為這種時候給他中藥呢他也很難吃下去，所以我們在開中藥的時候也盡量向藥膳方面去開，讓它更加好飲一點，適合他。
今日多謝徐教授接受我哋嘅訪問嘅。原來治療癌症除咗可以用手術、放療、化療之外，仲可以配合埋中藥治療，既可以舒緩症狀、改善生活質量、延長生存期嘅。如果大家想知道啲中醫健康資訊，就唔好錯過下一集嘅浸大中醫在線啦。拜拜。
Okay, so that was one of the videos that I curated for you today as a part of our lesson to reinforce the introductory part of the course. Now we're going to look a little bit more into the role of Chinese medicine dealing with side effects of cancer treatment. So basically in the West, the way we're regulated as a traditional Chinese medicine practitioners and acupuncturists means that we rarely, if any, time have hospital-based positions where we would work as a part of the interdisciplinary team. Most of the time, I would say probably 98% of the time, we are practicing in our own private medical practice, where patients may come referred by oncologists, or they may come because they did research on their own, and they may inquire about being treated alongside of Western medicine, which means that they already got diagnosed, the treatments may even start already, and now they have side effects. And so these side effects are varied, and they may be part of a radiotherapy or radiation, chemotherapy, or targeted therapy, which is often hormonal therapy, oral hormonal therapy. So how does the Chinese medicine works then? They're alleviating the side effects of ongoing biomedical therapy and improving biomedical effects. So usually in TCM, we would supplement or tonify qi and nourish the blood. We would enrich the yin or moisture or fluids in the body, nourish the blood. We'd also nourish the yin and generate additional body fluids. Depending on a patient's constitution, we may work on warming kidneys and strengthening kidney yang, or adrenal glands, supraadrenal glands. We may fortify spleen and harmonize stomach, guarding the central jiao or burner. We may work fortifying spleen and boosting kidneys at qi or yang level. We may dredge the liver from toxicity in hepatic cells and regulate liver qi. Liver being organ that's detoxing organ in the body, right? We may help invigorate blood and transform any blood stasis by controlling viscosity of the blood and pH chemistry of the blood, making it slightly alkaline. We may downgrade or thin down the phlegm, move it into dampness, and then dispel the dampness. We may work on lessening and softening any masses and dissipating lumps. We may use Chinese medicine as anti-inflammatory, clearing heat and relieving toxicity, helping lymphatic system to work. So obviously, there's a lots of things that we would do, in addition, obviously, of guarding the Zheng Qi or vital Qi. So depending on what stage the patient is, focus may be different depending on constitution, age, gender. So in generally speaking, when tumor is still localized and it may not spread, so stage 1, maybe stage 2, we may relieve toxicity, activate lymphatic system, and support overall immunity through Zheng-Qi. At intermediate stage, since the cancer cells are now spreading, often in local lymph nodes or regional lymph nodes, or what we call sentinel nodes, our treatment may be focused on, excuse me, on limiting spread of the cancer cells into local regional lymph cells and boosting overall immunity to combat the spread. In the late stage, which is stage 3, stage 4, cancer cells have migrated in multiple tissue, multiple depths, organs, nearby structures, and the treatment is there to boost already weakened qi in blood, and again aim to support overall immunity through Zheng-Qi, reduce toxicity, and allowing chemotherapy and radiation to work by limiting the further spread, obviously, of the metastasis and malignancy. So as we can see, there are some already established general theories and strategies that could be applied in some general way to almost anyone. And of course, then they're fine-tuned depending on, again, patient's age, the stage, the gender, any other underlying constitutional issues, and so on. So Chinese medicine often is used either pre or post-surgical, post chemo or radiotherapy. So before surgery, we often prepare the body for surgical procedure, which in itself, while it helps, is a form of trauma, right? So prescribing certain qi and blood tonifying formulas usually can help. The caution is that we stop administering formulas within 3 to 5 days before surgery. So we prevent patient bleeding out, because lots of tonifying formulas may affect the blood chemistry in a sense that when anesthesiologists and others apply different drugs to maintain the proper blood chemistry during surgery, there may be a drug herb interaction. So we would see the patient probably 3-4 weeks prior to surgery, and then we would taper off the treatment 3 to 5 days prior to surgery. So the herbs are out of the system and they wouldn't interact with the drugs used in surgery, but they would sufficiently prepare it. Post-surgically, we would focus obviously on strengthening qi and blood, especially nutritive qi, so yin qi, and defensive qi, the wei qi, right? So number of formula that we're going to see in this book, herbal formulas are split in 2 categories. The most common category is what we call hospital oncological proprietary formulas. These are formulas that physicians build their own experience. They generally don't have a name. They don't use the classical name, even they may be based on some classical formulas with heavy modifications. And then second group is using the classical formulas from classics that we all can use it. So typically when starting in oncology, we start with classical formulas, something that we know and we can modify to the need of the patient. After usually 10 years in oncological specialty, you then strike on your own and you start modifying, creating formulas of your own. So first 10 years is probably using of just a generalized known formula for oncology. So as we can see through the chapter, we have, for example, formula that's based on Yuping Feng San, jade screen powder, which is known to tonify lung and spleen wei qi, right? We have some other formulas that are modified on Shashen Mai Dong Teng, right? Or Wu Zhi Yin, 5 juice beverage, or combining often of these formulas. to help nourish yin and generate body fluids. To augment and relieve toxicity, we have additional formulas. And so occasionally physicians will come with injections as well. Acupuncture point injections are currently only legal in British Columbia and Canada. Other provinces are working on implementing as a part of scope of practice, but in Ontario, we cannot use them. So this is beyond our scope of practice. But they could be beneficial as well because we can target the tissue directly around the lesion, injecting particular pharmaceutically prepared herbal solutions. So acupuncture and moxibustion can play a role as well, particularly for nausea, feeling, vomiting, distension, dizziness and vertigo, insomnia, and other issues that may be post-surgically, post-radiotherapy, or post-chemotherapy very much present. Lack of energy, a low appetite, and so on. In radiotherapy and chemotherapy, again, treatment principles are to address the toxicity and boost the spleen and stomach to maintain proper appetite. Because so it's a two-pronged focus. One, you have to maintain patients' ability to eat, because without that, they're not going to have an energy to boost their zheng qi, right? And two, we have to address toxicity that these therapies are creating as a side effect of fighting tumors and cancers. So we have to help activate lymphatic system and help the body excrete toxins. So this could be through breathing, through sweating, through skin, and then through elimination, through urination, and through passing out stool, of course. So so obviously passing the urine and stool is our major ones. Sweating and breathing through are minor ones, but they still play the role. So supporting obviously zheng qi is very important because that happens through food, that happens through herbs. Again, the problematic part is in chemo and radiations, the patients often have suppressed appetite. They're very sensitive to smells, tastes, and herbs, unfortunately, do have both. So often we may switch from raw herbs to tablets or pills, trying to circumvent sense of smell and taste. While the tablets and pills don't have a taste and smell, they often cannot be manipulated further. So that's their weakness, but the strength is that it could be tolerated really well with the patients. So then we would prescribe certain known oncological formulas. At some point, we may find that toxicity from radiotherapy and chemotherapy or targeted therapy may affect blood chemistry. So blood will coagulate. So we may need to prescribe blood thinning formulas that nourish the blood and maintain the proper viscosity. And so we have to also be careful that these are administered away from any other blood thinners that Western medicine may prescribe. Or sometimes we may omit them if patients are long-term blood thinners like heparin and Plavix, or daily dose of aspirin, or some others. So we can also treat the patients preventatively. So again, kind of like pre-surgery, we can treat the patients a few weeks before radiotherapy or chemotherapy to boost their overall zheng qi and to reduce toxic effects such as malaise, vomiting, nausea, lack of appetite, problems with sleep, psychological state of anger, depression, fear, and others. These formulas, again, are usually tapered off to about 3 to 5 days prior to commencing of radiotherapy, targeted therapy, or chemotherapy. Just go a little bit forward because book is very exhausting in terms of information. And we're going to stop here at chapter 4. So here we're going to look at some specific side effects that happen during as a side effects caused by radiotherapy or chemotherapy. For example, we're going to look at bone marrow suppression, which is a serious side effects that really limits the body's ability to sort of boost its own Sheng Qi. And so patients who were prior to chemotherapy radiation already deconditioned and weak may present with bone marrow suppression. So, for example, they may be diagnosed prior to all this with leukopenia, right? So with the blood deficiencies, they may be suffering from leukemia, or they may have some other blood disorders. So, for example, they may have thrombocytopenia or anemia, aplastic anemia, and so they may have problems with clotting of the blood, right? And so these patients are at more risk to have long-term bone suppression. So in the case of leukopenia, we have general malaise, dizziness, problems with proprioception, so feeling body in 3D, problems with weakness of the limbs, so they cannot ambulate or move, palpitations, insomnia, anxiety. So general treatment is to boost the qi and blood at multiple organ levels, right? So, for example, here is one of the hospital formulas again that may be a combination of Bajing tongue and Buzong Yi Qi tongue, for example. Acupuncture points such as stomach 36, Bakshu points for spleen, for stomach, for kidneys may be used as well, as we can see it, to further boost basically the ingestion of the herbs. We generally don't use much moxa here because the smell of moxa may cause vomiting, unless patient is okay to be trying TDP lamp or electromoxa device, which has the same frequency and far infrared effects like a regular moxa, but there is no smell, right? So naturally, there's a lots of patterns here. So, for example, we may have deficiency of heart and spleen and blood and qi and blood levels. So, famous formula, ginseng and longan, or spleen returning decoction, gui pitang, jiejian with modification may be prescribed. Acupuncture formula like bladder 15, bladder 20, stomach 36, Bai Hui or Du 20, PC6, and then Ren or CV14 and liver 13 may be used as well to further boost spleen qi and heart blood, right? Liver and kidney yin deficiency, so mother kidney and child liver deficient at yin deeper fluid-like level. So we have dizziness, tinnitus, vertigo, achiness in low back and knees. You have that 5 palms, heat and sweating, 5 palms being palms, feet, and chest, right? Insomnia with profuse dreaming and so on. So then what we have is augmented Liu Wei Di Huang Wang tongue, so Rehmannia 6. And so it's augmented with Angelica root, peony. So it turns into Gui Shao Di Huang Tang Jie Jia, right? So it's further augmented to boost not just the kidney, but also the child, the liver at the yin level. Acupuncture here works by repositioning the fluids, so Bakshu points like bladder 18, bladder 23, Du 20, then we have PC7, kidney 3 and spleen 6 are used. Spleen 6 here is needle at kidney, the deepest level, which is about 1.2 cent. For most of the patients, right? And of course, nutritional therapy may be prescribed to boost the more yin. Sleep hygiene should be followed, right? deficiency of spleen and kidney at the young level. So that's a supraadrenal deficiency and thyroid insufficiency. So patients are physically and mentally fatigued. They have aversion to cold limbs, poor peripheral venal return, loose stools, low muscle tone, low appetite, right? And so often yogui and restore the right kidney, which is constitutional formula for kidneys, is prescribed with some additions, right, to boost the first namely kidney and then spleen young as well. Acupuncture here is used with needles, and some moxa can be used as well with so-called warm needle, right? So moxa can be used on chest and abdominal region. We can use moxa box, for example, on abdominal region from REN 12 down over umbilicus to REN 6, or over the bladder 23, L2, L3 lumbar region, right? Points such as CV or REN 4, DO4, stomach 36, bladder 23, bladder 20 can be used as well. So as we can see, bone marrow suppression often happens to patients who already have pre-existing blood disorders, leukemia, hemophiliacs, thrombocytopenia, and others. So we're going to stop here at damage to liver function, and we're going to take a 10 minutes break. And when we come back, we're going to look at some of these as well. So I'll see you back in about 10 minutes. Thank you. Okay, so we're going to continue. Let's look at damage to liver functions. So as a result of ongoing radiotherapy and chemotherapy, there's increased production of toxins that eventually affect hepatic or liver cells. So they affect usually blood chemistry. Liver produce enzymes. Liver usually produces two types of enzymes as far as blood chemistry, one to thin the blood and another one to coagulate blood, right? Once the liver loses ability due to toxicity to purify the blood to about 7.2, 7.4 on a pH scale, slightly alkaline blood chemistry, then that blood is shared with surrounding organs and tissue, and it creates all other pathologies. So treatment here focuses on detoxing the first and foremost hepatic cells and liver tissue and liver functions. So one of the first syndromes we're looking here is the one of liver Qi stagnation. So we have pain in the right hypochondriac region, distension, discomfort in the same region. Tongue is often normal, pulse is wiry. There may be some heat there. So treatment principle is to soothe the liver, relieve liver Qi stagnation and depression, and nourish and maintain proper blood chemistry. So formulas that we have here are a combination of two formulas. So one, to help reset the liver function. So that's a Chai Hu Shu Gan San. So bupleuron powder for dredging the liver. And then it's combined with Si Wu Tang, right? So He Si Wu Tang, so combination with 4 agents decoction to build the Qi quality and blood quality. Acupuncture here again is focused mostly on the liver. So we have back shu point for liver, bladder 18, we have Tai Chong, liver 3, right? We have PC6, we have liver 14, right? So all these front mu and back shu points reset the liver functions, and they combine with Yuan source points, liver 3, right? So Danzong, CV17 and CV6 or Ren 17, Ren 6 are used to move the Qi downward. Another pattern that we're looking is the one of spleen Qi deficiency with lack of strength, abdominal distension, low appetite, diarrhea. Often we have thicker, greasy coating on the tongue, maybe teeth marks, pulses wider and tready, often deep. So we're using a combination of supplementing the middle burner, Bu Zong Yi Qi Tang, combined with 4 gentlemen decoction, Si Jun Zi Tang, right? And some modifications. So the idea again is to reset middle jaw, particularly splenic functions, and then the boost the Qi and blood. Acupuncture here is used in combination of back shu points for stomach and spleen. So it's bladder 20, bladder 21, front mu point, so liver 13, and Ren or CV12. And then we have stomach 25 front mu point, a large intestine to stop the loose stools and diarrhea. Stomach 36 is obviously a key point for overall motility. Blood stasis is a deeper pathology than liver Qi stagnation, so often progresses after liver Qi stagnation. So we have stabbing, penetrating pain in right hypochondrium, darker blackish almost skin complexion, purple lips, purple sublingual veins, pulses wiry, rough, and surging. So we need to reset the blood chemistry, reset the liver, and then guarantee proper delivery of blood viscosity in a timely manner. So we usually use Free Wanderer bupleuron Mindang Wei formula. So it's Xiaoyao San combined with Ge Xia Zhu Yu Tang, which is the blood thinning formula. So it breaks down the blood stasis below the diaphragm, right? So, blood stasis can cause further problems in terms of pain, distension, anger, and other issues. Acupuncture and cupping therapy can be used as well. Again, focuses on moving and breaking stasis and moving the blood. So we have back shu point and front move point for liver, bladder 18, liver 14. We have yuan source point, liver 3, taichung. And then we have a combination of gushu, diaphragm, shu point, bladder 17, spleen 6, here at the liver depth, which is about between 0.5 and 1.0 depth at Sanjin Jiao, right? And then we have Danzong, and that moves the diaphragm, right? Damp heat often comes as a result of jaundice and increased liver toxicity, increase in liver producing bile, and an inability often for bile to be dispersed into small intestine, so the bile is moved around the tissue, causing secondary jaundice, right? So treatment principle is to clear the heat, benefit movement of dampness, and lower or reduce the jaundice-like pathology. So yin chen hao tang, oriental wormwood decoction, is often used to reset the bile production and decompress the common bile duct in the liver, as well as reduce the damp heat buildup in lower and the middle jiao. From acupuncture point of view, we use combination of the back shu points for gallbladder and liver. So bladder 18, bladder 19, gallbladder 34, gallbladder 40 to dredge the liver, reduce jaundice effects, and then back shu point for spleen, bladder 20, spleen 9 for dampness, and zongjing, CVO 3 to clear the heat and move the dampness, promote more urination, it's diuretic point. Sometimes due to radiation or radiotherapy and chemotherapy, we have asymptomatic increase in transaminase levels. And herbally, that could be reduced by prescribing 6-yellow combination decoction. So that's Liu Huang Tang enriched with Angelica Da. So it's Dangwei Liu Huang Tang with modification. So as we can see, a liver pathology is fairly common. It's one of the most common ones in radiotherapy and chemotherapy. Damage to kidney or renal functions is secondary to liver functions, or sometimes in certain patients who have constitutional kidney weakness could be the primary damage that they experience. One of the main things is edema, right? And a lack of glomerular filtration rates, so GFR is lowered, right? And so we may have additional symptoms, signs and symptoms such as anemia, fatigue, vomiting, fever, and blood in urine and other issues. So edema is generally one of the main presenting sign or symptom. So we're going to look at edema here through spleen Qi deficiency. So often with pale complexion, poor appetite, loose stools, edema is often marked in a lower limbs as well. So treatment principle is to fortify spleen, augment the movement of spleen Qi, and benefit movement of water. Spleen being the middle pump, so to speak. The lower one is the kidney, the middle one is the spleen, the top one or uppermost one is the lung. So we prescribe here ginseng, Perea, and white atriptylitis, so Shenglin Baiju Sun, combined with Wuling San Perea 5 powder, which is a known diuretic formula. We also use acupuncture protocol, boosting the spleen through use of front move and back shu points, so bladder 20, liver 13. We address the edema through spleen 9, stomach 36, stomach 25, and CVO 12 are also used to assist movement of fluids, and moxibustion can boost also some of the spleen Qi and spleen yang functions to better, through enzymatic actions, move the interstitial fluids. Blood stasis is another one that we see it. So we have inhibited urination edema, dark complexion, purple lips, often dark circles around the eyes. And so we use combination of Shao Fuju Yutang, so the decoction for expelling stasis from the lower abdomen, often used in gynecological condition as well, combined with 5-peel beverage, so Wu Pi and Jiejian with modification. So the first formula is focusing basically on moving the blood, while the second formula is regulating the movement of fluids. Acupuncture and moxibustion can be used as well. Combination of stomach 25 Tianshu, CV6, spleen 6 is used to move qi and blood and break down the blood stasis. And then CV3, bladder 28, bladder 22, bladder 23 are used to induce diuresis and regulate kidney functions and fluids. Moxibustion is used to move the blood circulation, dispel the edema and swelling. So water and dampness is additional syndrome that we see where edema is present, not just in a feet, but could be present in a face. There's a problem with inhibited urination. So again, the first formula is Wulingsan 5, Poria 5, so diuretic formula, Poria 5 powder. And then we have Liu Yi San Jiejian, so 6-to-1 powder. So basically, combination of these formulas affect the so-called Lin syndrome or painful urination syndrome, right? Acupuncture and moxibustion is used to augment the herbal therapy. So bladder 20 and spleen 9 are used to move the dampness and disinhibit spleen dysfunctions. CV3 being front move point to bladder is used as a diuresis or urination point. Stomach 25, CV12, stomach 36, while they boost the middle jaw, they also promote dispelling of the dampness. And again, moxibustion can help to better motility through fascial elasticity. Blood in the urine as a main clinical manifestation is usually secondary to edema, and it could be due to deficiency heat, excess heat, and others. So I want to just stop here as far as kidney functions. And I'm going to leave for you to read radiation pneumonitis, which is the inflammation of lung tissue due to radiation, which is less common. And cardiotoxicity, which we don't treat much in the West, but it's treated by our colleagues in China, because you need heavily involvement of technology to monitor your treatment through ECG to stent and monitoring through ultrasound, and unfortunately we don't have access to our scope of practice through that technology. So you often don't treat this because there's a higher potential for patient to have basically cardiac emergencies, right, like heart attack and others, cardiac tamponade. Radiation cystitis happens also, often in treating of gynecological conditions, and we treat this occasionally as well, again, as a supporting part of the interdisciplinary team. Radiation proctitis often is not as present that we see it in the West as a clinicians. Nausea and vomiting is very common, and it's one of the main things that we deal with through radiation and the chemotherapy. So we're going to look at that one. So nausea and vomiting being basically rebellious qi, namely stomach and some other organs. So we're going to look at access patterns. So external pathogenic factor invading stomach, causing hyperacidity and rebellious stomach qi, driving acid up the esophageal tube and causing nausea and vomiting. So we have sudden onset of vomiting. Sometimes there's a secondary fever, aversion to cold, maybe frontal headache, generalized pain, which may be epigastric and sometimes in the chest. Chest can also present with oppression and pressure in the chest. And so treatment that we focus here is to dredge any pathogenic factors that increase hyperacidity and rebellious stomach qi moving upward. So Huoxiang Zheng Qi San, the Gastogen Patchouli Vital Qi powder is the one that we use. So this is what we call stage 1 formula. It's used for acute presentation, which means it cannot be used for long term unless you severely modify dosing. And this needs to be modified from day-to-day basis if you're going to use it more than 4 or 5 days. So you need to have access to patients daily if you're going beyond a week of using this formula. Acupuncture can be used as well. So we have a combination of CV12, stomach 36. PC6 plays the huge role in nausea and vomiting. This is anti-vomiting point, right? Jigo is used here to move the qi downward and transform any toxicity in the middle jiao. And then we have a combination of He Gu, Life Descent 4, and Das Wei to release exterior and dredge any pathogenic factor. Food stagnation often happens because food that is ingested does not digest well due to toxicity and low stomach enzymes. So it ends up causing vomiting and diarrhea and fullness. And so patients often, as a result, stop eating, which is problematic because they need energy. So Baohe 1 is preserve the harmony pillars prescribed because it increases enzymatic actions in the stomach, reduces the vomiting and nausea. Acupuncture is usually done as well. So we have a combination of CV12, stomach 36, PC6 that we saw before. And here we also combine spleen 4 and PC6 activating basically one of the 8 extraordinary vessels as well to basically more stabilize the middle jiao. CV10, stomach 44, and stomach 25 helps disperse food that sits in the stomach and induces more peristalsis through stomach and intestines. Internal obstruction of phlegm fluids, when patients vomit clear and watery fluids and vomitus, often they hypersalivate as well. And generally, they have low appetite and no desire to eat. This is followed, of course, by general fatigue and dizziness and palpitation, problems falling asleep, and anxiety like emotional state. So here we combine 2 formulas. So Xiao Ban Xia Tang, which is minor Pinellia decoction, combined with Ling Gui Zhu Tang. So Poria, cinnamon twig, white atricolotus, and licorice decoction. So combination of these 2 formulas move first, so they stop hypersalivation, move the fluids, reduce the rebellious movement of the stomach qi upwards and reduce it to downward, and basically boost the middle jiao, spleen, and stomach. Acupuncture here is also used. So we have combination again of CV12, stomach 36, and PC6. And then we have stomach 40 that's used to reduce potential phlegm buildup and thin down any present phlegm into dampness. And then bladder 20, bladder 21, liver 13, CV12, so back shu and frontal points for spleen and stomach are used to reset the middle jiao. Liver qi invading the stomach, causing symptoms like vomiting, acid regurgitation, belching, oppression, chest oppression, are usually due to liver offloading acidifying blood into stomach, causing hyperacidity, because stomach uses the plasma from liver blood to create hydrochloric acid. If liver delivers increasingly acidic blood instead slightly alkaline blood, then stomach will produce more hyperacidity in the stomach, which will eventually splash upward. And so treatment here involves Pinellia and Magnolia bark decoction, Ban Xia Ou Pu Tang, and combined with the left-running metal pill, so Zolgen-1. So Zolgen-1 is the formula that sort of reduces basically inflammation as well. Acupuncture, again, is very similar to what we saw before. So we have a combination of CV12, stomach 36, PC6, and then we have front move point and U1 source point for liver. So liver 14 and liver 3 to move the liver activity to purify better blood and move the liver qi downward. So basically stop producing hyper acidity of hydrochloric acid in the stomach. And so these will be the more common excess conditions for vomiting and nausea. Deficiency patterns may involve things like deficiency cold of the spleen and stomach. So person vomits right after they're eating. They have this pale complexion. They're very deconditioned. They have loose stools. Generally, they more just laying and sitting. They don't want to do much. So treatment is to warm up middle burner, fortify spleen, harmonize stomach function, and reduce and move the stomach qi instead upward, downward. So lead zone 1, pill for regulating middle burner, is prescribed here, and involves warming herbs like ginger, and then also the anhui herbs like licorice, as well as tonifying herbs like baiju, so macrocephala and ginseng. Acupuncture here is used again, very similar to what we saw before. Combination of CV12, stomach 36, and PC6 is augmented by backshoe points, bladder 20, bladder 21, and frontal points, liver 13, and CV12 for spleen and stomach. Moxibustion at CV or REN4 activates original qi to warm up the spleen yang. So basically, we're dealing with hypothyroid condition, probably prior to radiation and chemotherapy. Insufficiency of stomach yin is usually patients who already had problems with stomach enzymes, maybe stomach ulceration, and so they have recurrent bouts of vomiting upon starting of chemo and radiation, dry retching, no desire for food despite being hungry. And so this is more common in radiotherapy or radiation. So enriching and nourishing stomach yin, reducing contraflow of stomach qi upward to downward, and stop vomiting is direction of the treatment. And we use the opipogum decoction, Maimen Dongtang, to move and nourish the stomach enzymes and coating. Right? Again, acupuncture protocol is very similar, so with some modifications here. So first 3 points are CV12, stomach 36, and PC6. We have here stomach 21, Liang Men, to anchor stomach qi downward, PC7, to drain any deficiency, heat, or inflammation in the stomach, and kidney 3 and spleen 6 to enrich kidney, spleen, and stomach yin. So as we can see, vomiting and nausea is very common in both radiation and chemotherapy, and it becomes the bulk of our treatment for lots of patients undergoing these cancer treatments. Anorexia often happens because patient was already predisposed to bulimia, anorexia, or they had eating disorders prior to it. And then, or it happens sometimes in patients who have normal appetite prior to treatments, but they suddenly develop problems because radiation and chemo are more prolonged than originally thought. And so anorexia is a tough one to treat because it involves a fair amount of nutritional counseling and the passive therapies like herbs and acupuncture, including manual therapies and exercise therapies. So where nutrition therapy takes the central role and it has to be adhered to. Dry mouth and tongue and mouth ulcers can happen, often due to acidity and vomiting and nausea, and is one of the not as common but present syndrome that we see in radiation. So I'm going to just leave for you to look through this one as well. Hair loss is often fairly pronounced, more in a woman than man. Chinese medicine theory states that that's because woman physiology is more blood-driven, man is more qi-driven, but it could happen in men equally if they're already predisposed to alopecia or something like that. And so treatment of hair loss often involves use of herbs and acupuncture, but for lots of patients, hair will regrow back once the treatments are over. The question becomes will the hair have the same quality as before? Often, first few months, they will regrow a thinner hair, which will over the time with nutrition and therapy grow to normal length in some cases, or not in other cases. So I'm gonna just stop here in terms of a presentation, because I want us to go and look some of the videos that we curated for you. And so we're going to look first at this video of the Singapore-based clinic. And so I picked this video because in Singapore, they operate very similar like us. They are state regulated as a primary caregivers, but they don't work in hospitals. They work in private clinics. So this video is very educational because it shows that practitioners are using also some of the new innovative therapies that are activating the lymphatic system. And these technologies are available to all of us. They're not protected by copyright or any other biomedical proprietary legislation. So let's have a look at this video.
A very good afternoon to everybody tuning into the webinar. We're very glad to have you here with us. I'm Davis from Oriental Remedies Group, and I'll be your MC for the day. Oriental Remedies Group is a patient-oriented leading healthcare organization that offers both TCM treatments and tech-enhanced therapies. Our team of 7 Singaporean bilingual physicians have on average over 10 years of experience and are trained in both traditional Chinese medicine and biomedical science. On top of TCM therapies such as acupuncture, Oriental Remedies Group is the only TCM clinic offering electrolymphatic drainage therapy, a state-of-the-art technology using an FDA-registered medical device to help our patients feel better, faster. Today's webinar is part of our web series, The TCM Way, where our experienced physicians share about how TCM can help you in every part of your life. So, why are we holding this series of webinars? It's simple. We have a bold vision to help all mankind be the best that you can be by helping you to lead a fulfilling and healthy life. We have seen many patients whose quality of life is affected by having poor health, which is why we strongly drive education to help the public be in the optimal physical condition to achieve their full potential in life. Oriental Remedies Group has been featured on various established media platforms, such as The Straits Times, Channel News Asia, and The Business Times. We have also proudly partnered with many companies, such as Health Promotion Board, MHC, and the studio that brought us all the movies we know and love, Disney. Our first speaker today is Physician Leong Wei Zhen, the Chief Medical Officer of Oriental Remedies Group. Physician Leong graduated from the Nanyang Technological University and the Beijing University of Chinese Medicine with a double degree in biomedical science and TCM, followed by a master's degree in TCM, as she was awarded the prestigious Chinese government scholarship. She set up Oriental Remedies Group in 2013 with the vision and passion to bring the best of both Eastern and Western treatments to her patients. Physician Leong specializes in providing cancer support, treating chronic conditions, and helping patients with their mental wellness. Our dear Physician Leong has been invited to many events as a guest speaker to share her wealth of experience and knowledge. An example would be the Pfizer Medical event with over 300 medical doctors, where she demonstrated and explained the benefits of acupuncture to the public. She has also been personally interviewed by Channel News Asia on her views for the best practices for TCM. And not only that, she has been featured in the local newspaper, The Straits Times, not only once, but several times. And despite all her achievements, Physician Leong still takes the time and effort out of her busy schedule to help the needy and unprivileged by providing free TCM and basic healthcare. Our second speaker for today is physician Julie Loh, a senior physician from Oriental Remedies Group. Physician Loh also graduated from the Nanyang Technological University and the Beijing University of Chinese Medicine with a double degree in biomedical science and TCM. She was even awarded the Chinese government scholarship for outstanding academic achievements during her time in Beijing. Physician Loh is an experienced trainer for general TCM wellness programs to the general public, secondary schools, and polytechnic students. She also has practical hands-on knowledge in treating patients with various ailments, being in active practice since graduation. Physician Loh also specializes in wellness beauty, pediatric care, and cancer support. And now we will begin the webinar for boosting your immunity for cancer warriors the TCM way, and I'll pass the time on to Physician Leong. Physician Leong, please.
Hi, everyone. Okay, thank you, Davis, for the introduction of the clinic as well as the physicians. So for those of you who are new to Oriental Remedies, hello. So for our existing patients, we are glad to see you here today again. Okay, so spend the hour learning with us. This is quite an interesting topic, right? Okay, so cancer is a topic that is very close to my heart because my grandfather, okay, the guy over here, okay, my grandfather was diagnosed with stomach cancer and passed away within a year. So before his cancer diagnosis, he was actually a very strong fellow. So he took care of me and my siblings. Yes, imagine him chasing after the four of us. Yeah, so he has to fetch us from school. We were pretty much under his care until my parents come home from work. So when he was diagnosed, it was already stage 4. And there were limitations to what his treatment that may be available for him. So suddenly I see him look like from this, okay, smiling fella, okay, to someone who is a lot frail and fragile. Yeah, so he was often very tired. He was constantly sleeping. Yeah, because I was like, remember last time he used to play, you know, the computers and stuff like that. But end up he was like, okay, lying down. He even moved his bed to the living room. Yeah, so at that point of time, I don't understand much about the condition. I was just like, hey, why is Ye like, you know, sleeping in the living room? But I could still remember what I saw in detail because even at a young age, it's very difficult to see someone who used to be very strong, okay, and suddenly, you know, like being weak and this person being very close to you. So it's really like etched in my mind. So when I became a TCM physician, I also wanted to have a special interest in helping cancer patients. Do you know that statistically, 1 out of every 3 deaths in Singapore is due to cancer? So imagine if there are 100 of us on this webinar, 30 of us would die from cancer. Yeah, isn't it scary? It is scary, but as a TCM physicians, I want to tell you and I want to believe that we can stop this trend from worsening. Okay, this is why we want to share practical tips with you today, okay, to boost your immunity. So if you are with us today, you're probably a cancer warrior, okay, or you have a loved one who's battling cancer, or you may be a caregiver. So we want to share with you knowledge and practical tips that you can do right after this session, okay, to support you to have better energy, to combat any of the side effects that you might have, and to have better immunity, as well as, most importantly, better quality of life. Okay, so for those of us who have been joining, for those of you who have been joining us, okay, in our past webinars, you'll know that, you know, our content is very gao, okay, we'll do the whole hour, okay. But as I was doing this deck, and I was happily doing it, I realized that there's a lot of topics and there's a lot of information that I want to share with you. So I told my team, I said, hey, can we raise it to 1.5 hours? Okay, so I'm going to split into 3 parts. Okay, this one whole 1.5 hours. Okay, the first part I'm going to share the causes of cancer. Okay, which is to fight something. Okay, so to fight something, we must first understand how it started. So in this section, I will bring about 2 keywords. 2 keywords. First one, immunity. Very good. Some of you may have already known about it. Number 2 is oxidation. Okay, secondly, Physician Loh will be sharing about the TCM tips. Okay, let's see. Yes, so Physician Loh will be sharing about TCM tips such as food, exercises, herbs that is useful and helpful for cancer patients. And some of these may not be commonly known. Okay, and the last part, I will share with you how Oriental Remedies, okay, can help you with our tech-enhanced therapies. So this is Oriental Remedies Group value add to our patients because we constantly source for treatments and technology that will help you feel better faster. Okay, so without further ado, let's go into why cancer. Okay, there's a lot of controversies, okay, of what causes cancer. So does drinking from plastic bottle cause cancer? Okay, what about 5G? Does it cause cancer? Okay, the reality is we don't know yet. Yeah, we don't know everything about cancer because science and technology is constantly evolving. Okay, first they prove this theory and then they disapprove it. Another theory, disapprove it. So it's constantly evolving. Okay, to show you how much our understanding of cancer, okay, over the last 90 years or so, okay, I want to share with you this shocking example of cigarettes. All of you know cancer, but cigarettes cause cancer, right? Okay, so, but, you know, we all understand this thing. Okay, if you smoke a lot, yes, there's a high risk of cancer. Okay, and that's the reason why, you know, we are even telling kids, you know, teenagers in school, do not pick up smoking. But yet, in the past, okay, studies have shown that, you know, cigarettes cause cancer. But in the past, in 1930s, right, tobacco companies actually used doctors in their ads. Okay, and the claim was, which cigarette causes less throat irritation? And then the answer is, oh, more doctors smoke Camels. Okay, so why? Because then they didn't know the link between cigarette smoking and lung cancer. Okay, so a majority of them actually smoke. Okay, so just to let you know, okay, my grandfather actually smoked as well. Okay, so he's a smoker, he's a heavy smoker, I would say. Okay, but smoking has been linked with, largely linked to lung cancer as well as stomach cancer. Yeah. So perhaps there were a few doctors in the 1930s who is warning others about what cigarette smoke can lead to. You know, it causes a lot of irritation and inflammation in our body and then may lead to cancer. But they are often viewed with skepticism, okay? And they are often labeled as paranoid, okay? So just as how we view people who warn us about plastics, who warn us about pollution, okay? But in my own opinion, do your own research, okay? If something may have a cancer risk, play it safe. Don't use it. Don't touch it. Okay, just avoid it. So it's better to be safe than sorry. Okay, so if some of you have been to the clinic and who know me, okay, I actually always use a glass bottle instead of a plastic bottle. Okay, so why? So what do we actually know about cancer now? Up to 50% of cancers are preventable. Yep. Okay, there's proven risk of cancer on the right. Things like diet, alcohol, smoking, they are all linked to our lifestyle, meaning something we can control. Okay, so I know all of you are very familiar with that, but let's look to the left. Like the cancer, like the cigarette example that we shared earlier, okay, there may be many cancer-causing things that we are exposed to, but not yet proven. Okay, so as research are constantly coming up and evolving. So maybe let's go with the first one, plastic bottles. Okay, so I think we have shared with, if those of you who have joined us for the previous webinars, okay, you probably know the answer. Okay, so we consume an average of 1 plastic card a week. Yes, a week. So this is my TCM license card. And then I have my EZ-Link card, my driver's license. Okay, I look good, right? Okay, as well as my NTUC card. Okay, so we consume 1 plastic card a week. Anyone knows how heavy is this plastic card? Have a guess. How heavy is this plastic card? Okay, we have 10 grams. Okay, 10 grams is a bit too much. Okay, Elena go for 5 grams. Okay, Davies go for 25 grams, 2 grams. Okay, so on average, each cut is about 5 grams. So week 1, week 2, week 3, week 4. So this is how much cuts, okay, how much plastic we consume in a month. So how many weeks are there in a year? How many weeks are there? Average about 52 weeks. Okay, my wallet, this is my wallet, it can't even hold 52 cuts. Okay, so that shows how much plastics we are consuming. Okay, and all these microplastics is thought to have a possible estrogen-like effect on men and women. Okay, and they cause potential hormonal imbalance. Okay, what about exposure to EMF? Okay, do you know that some people, they are so sensitive when their phones, they are switched on for very long, they actually have a buzzing sensation in their hands, and this magnetic sensation is very irritating to them. Yeah. So what about that? As well as cosmetics. Okay, cosmetics have known to have a strong link with skin conditions as well as cancer. There's even a group called EWG. Okay, you can go and check them out. They highlight the carcinogens they are used in the cosmetic industry. So at this point, sometimes I share these, be my friends or my patients, then they'll tell me, Physician Leong, like very bad news, everything has a possibility of causing cancer. Then what can I do? How can I reduce my risk? Or like if I'm diagnosed, how can I support my body to like recover better and even prevent a relapse? Okay, the question is, like we said, healthy life choices. If you have been diagnosed, okay, changing your lifestyle will support your recovery. So if you're going through painful chemo or radiotherapy, okay, or suffering from the side effects, okay, there are herbs, there are food choices that can help you relieve your discomfort. Okay, so if you feel anxious about the whole process, okay, probably you are just first diagnosed, okay, then we have partners with therapists who can actually okay, what we call to help you through emotionally and mentally. Or what about acupuncture? Okay, acupuncture have always shown to have a relaxing capability. Okay, help you relax and just ensure that your body can go through the whole process. Okay, so I have seen patients with late stage cancer. So they, by making very good lifestyle choices, they actually get to enjoy a better quality of life with their family, with minimal pain and side effects. Okay, so remember, today at the end of the tunnel, okay, there is always hope. So we want to share some of the choices, some of the tips that can help you boost your immunity, okay, and reduce what we call oxidation. Now let's look into, in order to improve your immunity, how did cancer first happen in the human body? Okay, how did it first happen? There is, like we said, this bar, a progression. Okay, so now this is a normal cell. Okay, so I want you to recall what you saw in a couple of slides back. Okay, what are the proven triggers of cancer? Yes, we have alcohol. Good. We have smoking. Yes, you are reading the slides well, because all of this actually cause oxidative stress or oxidation leading to DNA damage. So today, I want you to take away 2 keywords I said earlier. First one is immunity. Okay, the second one is oxidation. Yeah, so why is oxidation bad? Okay, to put it simply, if we cut an apple, okay, very common example, but just in case those of you who don't know, I'm just going to use it again. If you have an apple, you cut it up, and then after that, you leave it out there. Maybe you're busy, you forgot about it. When you come back, what happens is that oxidation occurs. Okay, the apple will turn brown like this in the picture. Okay, so oxidation will happen at every instant. Okay, so when that happens, when you see a browned apple, will you want to eat it? I don't think so. Yeah. Okay, so oxidation happens at every single instant when we are breathing. Okay, breathing. Yes, correct. So it's a necessary process in our body. Okay, but what we don't want is uncontrollable oxidation reactions in the body. So what we see here is actually a nice normal cell. Very good. Okay, so it undergoes DNA damage because of this oxidation. Okay, these are some of the examples that we shared earlier, right? Okay, so what happens is that when the normal cell undergoes oxidation, okay, this is what happens. It becomes a initiated cell, or what we call an abnormal cell. Okay, let's use an analogy. Okay, analogy, yeah? So we have the good cells. Okay, so good cells are like, you think of it, a young, innocent boy. You know, they are very nice, very cheerful, going to school. Okay, but when oxidation happens, okay, they become bad. Okay, so they become what we call like a gangster cell. Okay, so gangster cells, you often have this thing called a DNA repair. How does DNA repair happen? Because of your immune cells. Okay, so immune cells, you think of them as police. Okay, they don't straight away capture and then send to jail, right? So they will let you undergo, you know, different things like go with the social worker, you know, maybe make it turn over a new leaf. Okay, so gangsters can become back a normal cell. Gangster can become back your normal innocent boy. Okay, so at this stage, there's always choices for the body to do DNA repairs. Okay, so what happens? Okay, gangster cells, if you think of them, like last time we watch Hong Kong dramas and all, right? Okay, so gangsters often have more money. Okay, then they have more power than your normal innocent boy. So what they do? They bribe the policeman. Okay, so they bribe the policeman. So similarly, these abnormal cells in the body, they have so much power, they can actually turn off systems in the body. Okay, they can switch off certain mechanisms so that your policemen no longer recognize them. Yeah, so it's like bribery and corruption. Okay, so this analogy doesn't take place in Singapore. Okay, in Singapore everyone would catch. Okay, but imagine, okay, if your innocent boy becomes an abnormal cell, becomes a gangster cell, and then it turns off the mechanisms in the body, your immune cell can no longer recognize it, and it starts to grow. Okay, if your policemen don't catch the gangsters, they start growing and spreading. Okay, so and expanding their reach. So now no longer just one cancer or one gangster cell, it becomes a huge gang. Okay, and this, you see the difference? Initially green color, right? They actually transform itself. Okay, transform. So now there are even 3 different types of cells in the spread. Okay, so when our immune system is unable to control this, the tumor mass starts growing and starts spreading. They can even draw blood supply towards themselves, okay, and establish a whole new network. So maybe in like if you think about it, I've seen the tumor mass size of a ping pong ball, okay, size of an egg, and even the size of a guava. Yep. Okay, because of a lot of transformation. Now, okay, so this whole initiation process, right, is actually worsened by excessive oxidation reactions. Okay, so I want you to come with me. Okay, so oxidation is good or bad? Can anyone just answer? Is oxidation good or bad? Very good, Jingyi. Okay, Mel as well. Okay, June as well. Okay, oxidation is bad. Okay, what about immunity? Immunity is good or bad? Okay. Okay, my senior physician said, okay, good in a controlled amount as well. Okay, so basically immunity, everything not in excess, is in a balanced mode. Immunity is important and is good for the body. Okay, and oxidation is bad. Okay, also in a limited amount, because we need to progress and all, right? Okay, so the natural question will be, Physician Leong, how can I tell if my immunity is good? Okay, do I have to take like blood tests and things like that? So I'm going to teach you how to be a TCM physician in your household. Okay, I give you 3 seconds to run and get a mirror. Okay, 3 seconds, go. Okay, or just move yourself into the toilet, switch on the light. Okay, naturally better to be white light. Okay, so I want to give you a tip how to read your tongue. Okay, why the tongue? Anyone knows why the tongue? Okay, so some say because it's the easiest thing to see. No, and give one of the reason why. Okay, but the tongue is actually a beginning of your digestive tract, and it gives a good reflection of what is happening inside the body. Okay, so this is how an ideal tongue looks like. Okay, all of you, start singing your tongue. Ideal tongue. Wow, nice pink. Wow, very chill. You see the coating on the tongue? Thin coating. That's necessary. Okay, thin coating. The size of the tongue, very nice, sharp curves. Okay, how many of you want this tongue? Okay, myself included. Of course, I want this tongue. Okay, so how many of you do not have this tongue? Okay, you can just type in the chat. Okay, I'll try to look at it on and off. Okay, so, but if you do not have the ideal tongue, is your tongue looking like this? Yeah, so this tongue, okay, what we see is what we call the teeth marks all around, okay, and the coating is very greasy. You know, it's like very murky, I always like to say. Okay, so this is a sign of qi and immunity, qi deficiency and weakened immunity. So immunity and qi, they are synonymous. Okay, if you have a strong qi, okay, naturally it will derive a strong immunity for the body. So this kind of tongue, okay, the one in the middle, they tend to have gas in the stomach, bloatedness, sticky stools. Okay, some of this may be, these people may be overweight. Then they have very sluggish energy, like yeah. Okay, so this definitely points to sub-health in your body. So if you have this tongue, please do take note. Okay, just check with a TCM physician. Is there anything you can do to help yourself? Yeah. Oops. Okay. So Elena says your mom's tongue. Yes. Okay. So you need to check with a TCM physician. Okay. But on the right, okay. So everyone get ready your phone. I want you to fastest fingers first. Tell me, what do you see on this tongue? What do you see on this tongue? Anyone? Oh, someone said, oh, clot. Okay, you know your stuff. Okay. Oh, someone said colorful. Yeah, very colorful. Different shades of red and purple. Okay, yes, purplish tone as well. The crack as well. Okay, so this tongue is what we see in a lot of people with chronic conditions. Okay, it's a type of what we call blood stasis tongue. Okay, imagine now you don't see it as a tongue. Okay, but you see it as a piece of meat when you go grocery shopping. Will you buy this tongue? Do you buy this piece of meat? Oh, okay. Someone said 50 shades of purple. Yeah. Okay. So naturally you wouldn't. You will avoid it. Okay. Even if it's the last piece of meat, you will go to another section, buy more vegetables. Okay. So if you have this tongue, there is really, you have to take a hell lot of concern about it. Okay. Because these people may suffer from chronic conditions. Okay, they tend to have cold hands and feet, a lot of aches and pain throughout the body. Okay, ladies with this tongue, okay, we have seen a lot of them. They have very poor bad menstrual cramps, blood clots. Okay, signs of cysts and fibroids in their body. Yeah. Okay, and a lot of cancer patients actually come presenting with this tongue. Yeah, I've cooked with pig liver, yes. Okay, so now that you know how to read your tongue, how often should you read it? How often should we read it? Actually, every single morning. Okay, every single morning, before you brush your teeth, just check your tongue. Okay, after you look at the tongue, okay, go and find out what are some of the healthy choices you can make. Okay, some of the healthy choices you can make. So, what are we going to do? Okay, when we want to fight cancer, it's actually very simple. We want to reduce oxidative stress and we want to strengthen and boost your immunity. Why? Because the speed of growth of a tumor is dependent on these two factors. Okay, so we have a scale down here. Okay, so remember the body is always about a balance, right? Okay, so for a tumor mass, okay, I'm not saying cancer, I'm just saying a tumor mass, okay, when it grows bigger in size, it's because there's always more oxidation. There is actually weakened immunity or weakened qi, okay, and then more blood and phlegm stagnation. Okay, it just clots down there. Yeah. On the other hand, what we want is to strengthen your immunity so that it can help to combat this tumor. Okay, reduce oxidative stress, strengthen your immunity and qi, and then what else? Yes, correct. Reduce blood and phlegm stagnation. Okay, so focus on the green box. Okay, how to shrink a tumor. Okay, how to shrink a tumor mass. Okay, so the tips we'll be sharing today revolves around these three ideas. Okay, so we have to reduce oxidation and strengthen qi and immunity. That's through herbs and the food that Physician Loh is going to share later. Okay, how to reduce stagnation is through the rebounding exercise. Did I say release? Okay, pretend you never hear. Pretend you never hear what I say. Okay, but I'm going to pass on to Physician Loh. Okay, so she's a senior physician with Oriental Remedies. Okay, she's an expert in using both raw herbs and powdered medicine to help her patients with their conditions. Okay, I like that she really used very simple analogies and make it easy to remember and understand and absorb by her patients and all. Okay, so she has practical hands-on experience with various ailments. So without further ado, let's welcome Physician Loh. Physician Loh, please.
I thank you, Physician Leong, for sharing with us the various triggers that cause cancer. And we are half a physician now because all of us know how to read our own tongue. So you can differentiate between a normal tongue and another person's tongue with poor immunity, phlegm stagnation, blood stasis, etc. And most importantly, we learn two important points. Firstly, it is to improve immunity and reduce oxidation. So for my part, I will share with you the TCM portion, which is how food and herbs can help to improve your immunity and reduce oxidation as well. So all of us know that good nutrition is very important for all of us, especially for the cancer warriors out there. And in fact, we can sort of nourish our qi and improve our immunity by the food that we take. So today, I'll break it down into two main portions for you. First, the herbs or food that you can take to improve your immunity, that's number one. And second, to clear that internal heat that you may be feeling. So what are the herbs that are good to improve your qi or to improve your immunity? So especially for those who are undergoing chemotherapy or post-surgery, you might be feeling very tired. You may have very poor appetite. You will be experiencing fatigue. And if you are to go about going around your daily lives, you can feel a little bit unmotivated. So our focus in treatment will be to give you the extra boost in energy so that you can reduce all these symptoms. So first up, the herb. I guess all of you must be very familiar. This is called astragalus, also known as Huang Qi. And Huang Qi, this herb, it is known for its immune boosting functions. It is antiviral. It has anti-tumor functions. So it can usually help in some forms of cancer. As all of us know, our immunity declines with age, which means when we grow older, our ability to fight illnesses declines and our immune system will become weaker and we cannot fight all those viruses, bacteria, and cancerous cells. So this is why astragalus play a very important part in giving the body the boost in qi. It can increase the number of stem cells by encouraging them to develop into active immune cells. So you remember Physician Leong talked about your police cells? So in fact, the more police cells there are, the better it is and the higher the chances of us catching the gangster cells. So next up, we have Lingzhi. So I guess I don't have to explain a lot about Lingzhi, but there is another name of Lingzhi called the mushroom of immortality because it is known for its capability to boost vitality as well as improve the symptoms of patients who are experiencing tiredness or poor appetite. Usually it is used by patients with poor chemo, post-chemo, not poor chemo, it's poor immunity, post-chemo or surgery. And we often use Lingzhi for patients who have low energy level, poor appetite, or even breathlessness during their course of treatment. So do you know one fun fact? The highest concentration of active ingredient in Lingzhi actually lies in the cracked spores of Lingzhi. So if you go Lingzhi shopping, you will realize, why is the price of cracked spores of Lingzhi and Lingzhi so different? So you do keep that in mind, and when you go Lingzhi shopping, you can go find out more. So for both astragalus and Lingzhi, they are both suitable to incorporate into your herbal soup. So around 10 to 15 grams will be sufficient. And if you are taking existing TCM herbal medication or ongoing treatment, so maybe you can take the soup once a week. And if you are not taking any form of herbs, 2 to 3 times a week will be sufficient. Other than boosting immunity, let's make a guess. What is the similarity between Huang Qi and Ling Zhi? Ah, yes, very clever. Both herbs are very, very, very high in antioxidants. So you can see how everything is linking up together, boosting immunity and reducing oxidation. Next up, for some of you, treatments such as chemotherapy and radiotherapy, they can create pretty bad side effects. And for some, it can be very hard for them to bear. So I've seen some of our patients experience dry mouth, dry tongue, and they have this sort of heat inside their body that they cannot exactly pinpoint. So this is all characterized under heat symptoms in TCM. So, and for some tumors, they are characterized as 热毒, which means heat toxin after assessment by our physicians. So for these cases, adding some herbs to remove that internal heat will be very important. So the first herb, which is Sheng Di Huang, which is the black herb that you see on your left. Oh, I have the sample over here. I hope that you can see. Yeah, it is a very, very black herb. This Sheng Di Huang, it is traditionally used in TCM to help clear the heat, nourish the fluid. So it is used for cases with low-grade fever or thirst, dry mouth, constipation, etc. And in TCM, these symptoms will be characterized under warm pathogenic diseases. And in a modern context, side effects of chemo or radiotherapy. So after taking this herb, the Sheng Di Huang, patients will usually feel there's more fluid inside the mouth. They may feel less of the heat and generally feel more comfortable. That's the first herb. And the second herb, most of you must be very familiar with it. It is called Xia Ku Cao. Last time my mother used to cook Xia Ku Cao very often for me. So after I know about Xia Ku Cao, I tend to drink it lesser. I will let you know why later. So it is very commonly seen because we drink in the herbal teas that our parents may cook, and it can help to clear internal heat. So another function of Xia Ku Cao is that it can help to reduce nodules or dissolve nodules in TCM. In Chinese, we call it 软坚散结. And similarly, after taking Xia Ku Cao, some patients will actually feel relief from any form of headache, eye pain. They are also considered under heat symptoms. So why is this herb not suitable for long-term usage? Yeah, because it is too cooling. Some people may have diarrhea, and because for some conditions, you may not belong to the heat segment. So for cancer patients, I will highly encourage you to speak with your physician so that your physician can guide you on the herbs for your specific constitution and also customize the herbs wherever you are on your recovery journey. So a lot of patients will ask me, Physician Loh, how to eat those herbs? It is too bitter. I can't really swallow. So, which brings me to the making of your herbal soup. So it is possible to make herbal soup very yummy if you add the correct ingredients. And we have specially formulated herbal soup that is good for the family to drink on a regular basis. So the herbs that we choose are not only good for general public, it can also help to tackle some of the side effects our cancer warriors that are out there may be feeling post-chemo, post-radio, or post-targeted therapy. So you can conveniently cook one whole pot of soup and drink it as a family. So maybe let me share the recipe with you. So when we cook herbal soup, we will definitely need a base, right? The base, you can choose big bones, such as pork bone, chicken bone. Some prefer fish bone. It is okay as well. And for vegetarians out there, you can choose any mushrooms of your choice. In this case, we use shiitake mushroom. Within the soup, you will want to add something to nourish your qi, which Physician Leong said earlier, to improve your immunity. So as mentioned earlier, you can add in Huang Qi, Dangshen, or Baizhu. These three herbs are well known for their qi boosting capabilities. At the same time, Baizhu, the third herb as shown below, it can also help to improve digestion as well. Next, we see a lot of patients experiencing appetite issues. You might struggle with your appetite. you have no appetite, you can't eat, but at the same time, you are losing mass. So for these people, it is very important for you to take in enough nutrients in order to build up that line of defense to combat cancer. So I highly encourage you to add in some herbs to improve your appetite. The herbs include Fuling or Chenpi, and these two herbs can strengthen your digestive system. Finally, for those of you who are characterized under the heat toxin segment, you may be feeling heaty, dry throat, dry mouth, constipation. Remember I said earlier? So you may want to add in some herbs to clear the heat. You can add in Sheng Di Huang. You can add in Sha Shen. If you belong to the heat symptoms, you can add these herbs in for flavor. And for those of you who are worried that Sheng Di Huang, because it looks black, right? If I add it into a soup, will my soup become black as well? Do not worry. I've tried it myself before. No, it wouldn't become black. And actually, it tastes quite okay as well. So remember, I tell you about the frequency when you drink the herbal soup. For those with ongoing treatment, you can take it once a week. For those who are not, you can take it 2 to 3 times a week. Then there are some patients who will tell me again, Physician Loh, I am very tired because you are doing all those treatments, right? You have chemo, radio, and this can be this can zap the energy out of you. So we know because we hear a lot of this. Yeah. So what we have done is to formulate convenient herbal teas that are suitable for regular consumption. In our immunity, as in on the left, we have included herbs such as Huang Qi, which is our hero herb, as well as red dates and Gancao. And these works together to improve your digestion and improve your appetite. And what I mentioned earlier, a lot of patients will experience heat symptoms, including dry throat, uncomfortable dryness, or heat inside your mouth, inside your body. This is why we have formulated the throat soothing tea, which can help your body produce more fluids, keeping you more hydrated and comfortable. So compared to soups, the tea making will be slightly more convenient. Just take out 1 tea bag, put in a cup, add in 1.5 liters of water, and you can drink it for the whole day. You can even drink it for the whole family. Take it once or twice a week will be sufficient. And it can be shared with a family, especially for those who are looking at drinking some tea to improve your immunity. You can choose immunity tea as well, or you're having some sore throat after all the video conference, you can choose your throat soothing tea. So now we are done with food. So we talk about herbs, we talk about how to make your herbal soup and your herbal tea. And so for those of you who will want to know what kind of soup and the soup recipe, right, you can feel free to let us know as well. And after we are done with food, let's move on to exercise. Just now, Physician Leong talked about exercise, right? Have you heard about that? If you know about that, right, I will talk about it later. Let me talk about this organ called Sanjiao first, because this is largely linked to the exercise we are doing later. So what is Sanjiao? Sanjiao is actually a virtual organ in our body. It is a network where all the fluids, all the food essences and waste pass through. So think of it as a like hollow organ, a pipe. So if everything is smooth flowing, with all the fluids, food essence, all the waste is flowing smoothly, any form of blockage in Sanjiao will result in the retention of fluid. It can manifest in the form of urine retention, fatigue, edema conditions, and in Western terms, these conditions are linked to what we call blockage of your lymphatic system, which is also called lymphatic blockage. So now, think of Sanjiao or your lymphatic system as something like the pipes in your house that drain your house. So what will happen if you realize that there is a clog? You will try to unclog it, right? Why? Why will you try to unclog it? Because otherwise, the whole house will smell. There will be very unpleasant odors. There will be hair and bacteria clogging up the space. And it can cause a lot of damage inside your house. And to troubleshoot, if you call the plumber, say, hey, there's a clog inside in my house, I need you ASAP. When the plumber comes, the plumber will have to find the source of the blockage, unclog it so that the substances can flow more smoothly in the pipes. Otherwise, in the long run, the pipes will burst, which is something that all of us don't want. So just like your house pipes, the lymphatic system can also be congested. It can also be blocked by proteins, by toxins. And these congestion can lead to adverse health conditions such as fatigue, compromised immune system, or chronic skin conditions, cold limbs, bloating, headaches, etc., etc. And actually, many cancer patients have been experiencing this kind of symptoms for years. They just didn't know that the reason it is because of congested lymphatic drainage. So what should we do? We should clear the pipes regularly. So regularly cleaning the pipes can maintain their function, and it is a good strategy to prevent a clog in the first place. So by clearing our lymphatic system, right, it can also allow our immune cells, it's also called lymphocytes, which live inside the lymph nodes, to be more alert. So you know, when maybe you are going to get a sore throat, right? You may experience, some of you may experience swelling over here. Am I right? Anyone experience swelling over here when you're about to fall sick or when you don't feel well? So these are actually signs of lymph nodes, swelling up as the first line of defense when the external pathogens enter your body, right? So when the pipes are clear, the pulleys and the lymph nodes, they'll be more active. So they are able to catch the things that are passing through, and they are able to eat it up and clear it out more effectively. So this is why people with a smooth flowing lymphatic system will fall sick less easily. They'll feel lighter with lesser inflammation, less aches, less pains, etc. So remember, if there is a blockage, you will need to unclog your lymphatic system. So to help with unclogging the blockage, let us do some rebounding exercises. So have you heard of rebounding exercises before? Or people may know as jumping on the trampoline, bounce? So if you can see the GIF on the left, right, this is a person jumping on the trampoline. So rebounding itself, it is a low impact exercise. Jumping on the trampoline can help with lymphatic drainage, and it is also friendly on our joints. So when you bounce up and down with the gravity, bouncing up and down motion, it can help in the lymph flow. And it can flush any form of blockage in the lymph nodes. So it can increase the drainage of toxins from organs and muscle tissue. So it is normal to feel extra thirsty after the exercise. Because through this exercise, it can also help to improve our blood circulation, increase the oxygen supply to the different muscles, different tissues, which will in turn elicit a very healthy immune response to combat cancer. So the one that you see in the picture, right? There's different kinds of bouncing methods. And the one that you see that we show now, it is actually a low impact bounce. It is suitable for all to try. So rebounding is also good if you do it every day. If you have tried rebounding like me, you will know that after bouncing for around 5 minutes, I feel really, really tired. My heart is thumping. It is like a cardio workout. So regular rebounding will strengthen your heart as well as strengthen your lungs. So this can result in a higher breathing capacity throughout the body. So as a result, you'll feel more energetic, you have increased resistance, stamina, and speed. For those of you who have yet to try this exercise, I have noticed that ActiveSG, that's a few months ago, I realized that ActiveSG, they do have rebounding exercise, but I think they termed it bounce. So if you do exercise and you do use ActiveSG, you can remember to give it a try, and you can let us know how you feel after that. So now let me pass the time back to Physician Leong, who personally has researched a lot and brought in a lot of new technology to help our patients feel better faster. So she has worked with many cancer patients in the past 7 years and will share with all of you the tech-enabled therapies that can help. So let me pass the time back to Physician Leong.
Okay, thank you, Physician Lo, for sharing with us the herbs. Okay, do you remember herbs? Yes, Huang Qi and Ling Zhi. Okay, Sheng Di Huang and Xia Pu Cao. Okay, so also the tea. Okay, and the soup as well. So for those of you who are like me, Cantonese, then we like drinking soups. Okay, as well as the rebounding exercise. Okay, so all of this is to strengthen your qi, strengthen your immunity, reduce oxidation, and as well as combat some of the symptoms of your chemo and radiotherapy. Okay, so at Oriental Remedies, we help many patients in their cancer journey. So I group them into 3 groups of patients. Okay, so the first one is those who are keen on prevention. Okay, so they don't have cancer, okay, but they may have seen their loved ones who have suffered from it and want to do their best to prevent it. Okay, then the second group is that those who have been diagnosed early and they want to use TCM to complement their current conventional treatments. And lastly, okay, for the late stage cancer patients, they want us to help them with their managing the side effects, managing the stress, the sleep, as well as the pain management. Okay, so no matter which category, okay, which group you are on your cancer journey, remember that there's these three things that will aid your body. Remember what are the three things I shared earlier? Okay, the first one is reduce oxidation. Second one, strengthen your qi and immunity. And lastly, yes, very good. Yes, reduce stagnation. Okay, so all these three will aid in the recovery. So I will share two of our tech-enhanced therapies to help you all. Okay, so I know there are many patients who are actually very well versed in herbs as well as acupuncture for cancer support because you have done enough research. Very good. I like patients who do their research. Okay, so for this webinar, we want to share the knowledge that will give you the extra boost. Yeah, okay, the extra boost that will give you to help you in your cancer journey. So continuing from the rebounding exercise as well as the herbs. Okay, so in the past, when I was in China, I heard this patient say, okay, the doctor advised him to go on a more vegetarian diet, and then he was saying like, oh no. Okay, in Chinese, it says like this. Okay, yeah, even with my Chinese tone, it says like this. 那我做兔子呗. Okay, so in translation, it says that why don't I just become a rabbit because I have to be put on the vegetarian diet. Okay, so plus the rebounding. Okay, then you toing. Okay, yes. So be a rabbit is good. Okay, so nice and docile. Okay, but the thing is, all of these will help to unclog the lymphatic system. Okay, so after being a physician for so long, I can predict, okay, I can have a vision, I can predict what you're going to do. I tell you about rebounding, all of you, wow, go and find the rebounding trampoline and then go and do rebounding. Very good, okay? But when I see them 2 weeks later during consultation, I will say, how is your exercise regime? You know what they say? Okay, I only managed to squeeze 5 minutes one day. Or some of them say, oh, it's in the corner, but I'm too busy to do, or too tired to do, and all. Okay, 8 out of 10 patients will actually tell me that. Yeah. So why? Because all this takes energy and habit change. Yeah. So today I want to share with you a very relaxing electrolymphatic drainage therapy. So this is what we have in our clinic. This technology is more efficient than rebounding. Okay, so imagine this is like a smooth, soft, manual lymphatic drainage with a machine. Okay, so this is not just said by me. Okay, why not we just listen to Dr. Lodi? He's a medical doctor. So he specialized in cancer treatments, okay, for the past decades. Okay, so he has successfully reversed even stage 4 cancer with holistic methods. So some of you who are with us with Oriental Remedy since like long ago, okay, I went to Phuket early this year, okay, before the COVID-19 and all. It was in January 2020. We went there to train his therapists how to do ELT for his cancer patients. Yeah, all the way in Phuket. Okay, so he uses a series of holistic methods, okay, and ELT is one of them. Okay, maybe not from me saying, let's hear from him.
We clean the colon and we get the lymphatics because health is circulation, it's moving. For example, if you come to a river and you're hiking, you'll drink out of it. As long as it's running and sparkling, but if you down the road a little bit, you see that it's turned more like a pond, you're not going to drink out. So when circulation stops is when we get, that's why the conventional advice, you have a lymph node in your, from the breast cancer, don't do any manipulation. Sure, just let it sit there and fester, let it become worse. No, bring back the circulation. We do lymphatic therapy. Women come in with tumors really this large. After they get a good session of lymphatic therapy, they're down. You decongest it, get it flowing. That's what it's, and don't take out lymph nodes. If someone says, this cancer is in my lymph node, I'll say, yes. I mean, unless it's obliterated it and you've got a, then that's another story. But if it's in the lymph node, then your lymph node's doing its job. It's assessing it and it's developing an appropriate response. It will send out the cytokines to call in the other guys to alert the rest of the body. That's what it does. It's like CIA headquarters, all over the place. And you've got the officers out there, and with just T cells, macrophages, they're out there doing that. So, and then you got to bring them in the headquarters and question them, and then you said, that's the way it works. So you don't want to remove. So anyway, we use lymphatic therapy, both manual massage and this ELT, which uses argon and krypton. They're noble gases, and you just move it above in a glass tube. You move it above the skin, and it moves along the lymph. It's very good.
ALT.
ELT, electrolymphatic therapy.
Okay, and you said it uses argon and krypton.
And other noble gases. And noble gases are the ones in the periodic table that don't have any reactivity. They have complete outer shells. For example, chloride, fluoride, bromide, and iodine have a negative charge. And sodium, potassium, magnesium have a positive charge. Well, there are ones over here that are neither positive nor negative. They call them noble gases. They don't react. The veins are draining out the waste, but 10% of that waste is left on purpose for the lymph system so that it can go to the lymph node, and the lymph node can figure out if there's anything needs addressing, any kind of defense response. Right. So that's the way it was designed by the designer. So we have to keep that flow. If we don't keep that flow, if we start getting congestion, we're going to have a problem.
I went on mute again. I'm so sorry. Okay, so anyway, I was just saying to myself, okay, because I'm the only in the room. Okay, that how he's a great guy. So we met him, me and Henny. Okay, met him in Phuket early this year. So we are glad to be the first TCM clinic, okay, to actually use this FDA registered medical device to help our patients. Okay, so we also use it for people with general wellness concerns as well. Many patients actually love this non-invasive therapy, okay, because they could feel a significant difference. Actually, I want to share one, okay, so it was 2 years back, couple of years, maybe 2 to 3 years back. Yeah, so I have this patient, young chap, okay, he has tongue cancer. By then, when I met him, it was already stage 4. So he was young, he was 30 plus, he just got married 1 year ago. Okay, so when I saw him, he had only managed to do one round of chemotherapy, because after that session, his white blood cells drastically went down, and the doctors told him, there's nothing much you can do. You just have to undergo palliative care and support. So, but he and his wife are very, very determined people. They are like, wow, they want to do everything they can to help themselves. So they stay all the way in the east side. Then we didn't have the East Coast branch yet. So they just travel down, on a regular basis just to do ELT. So because his tumor is like really huge around here, okay, so he couldn't verbalize his words. So we rely on writing, we rely on hand signals, where's the pain? And he'll point to me here, there, everywhere. So, but when I see him, right, I can see that he's very, very tired. Yeah, as the condition progresses, right? So I can see him visibly tired. Probably from the sleep, probably from the pain at night. He has to use like morphine patches and all. So, but after every single session, right? Because he couldn't talk, I'll ask him, hey, how are you doing? How is it today? Then he always, that's all I get from him. 2 thumbs up. Okay, so I asked from his wife to understand more. So his wife said that he usually slept better. The pain is more managed on the days that he do ELT and all. Yeah, so it was actually really memorable because he was actually asking for a session 2 days before he passed away. And the wife messaged me, and then he was like, "Oh, can we arrange for a session on Saturday?" Then Sunday, and then they didn't turn up. But then so at the point that I didn't have manpower to ask them much. But then the wife told me on Sunday that he passed away the day before. Yeah, so I think this memory is very strong because it actually how do I say? It actually hit me that we can actually help our patients to improve their quality of life with our therapies. Yeah, so so some of you who have been our regular patients, very good. So you probably have done ELT as well, because we try to get everyone to try a bit, to make sure that they can get their system unclogged. Okay, so I'm going to ask you, there's 3 things our therapists and myself always tell you. How do you know if your lymphatic drainage is congested? 3 things. So 1 is flow. So what is flow? Okay, so I have the cable here. Okay, so this is inside this glass probe. Okay, that's where the noble gases are. Okay, so the flow, the sound. Okay, so what happens is, okay, if the area has a smooth flow, okay, so this, assuming on my hand, this area has smooth flow, this is the congestion. Okay, so what happens is that if the flow is like this, nice and good, yeah, so this is when there's less congestion. But when it comes here and there's congestion, it'll be like that. Yes, very congested, very sluggish movement. Okay, so we need to decongest and sweep again, decongest and sweep again. So that's flow. Okay, what about sound? Okay, because it's ionized, what happens is that it produces a penetrable depth. Okay, so when the area is smooth and clear, it will be a loud sound like zzz, zzz, zzz. Okay, so but areas are congested, this is what happens. So it'll be like zzz, zzz, zzz. Do you hear anything? No, it actually went silent. Yes. Okay, so what happens is that we need to decongest it and clear, decongest it and clear. Okay, so this is just gliding over on your skin surface. And last one is what we call the smell. Okay, smell is something. This is not just for cancer patients, okay, but also people with a lot of inflammation in their body. Okay, the smell is really very, very strong. Okay, and it can happen even after a 15-minute session. Okay, so we need to decongest and ensure good lymphatic drainage in the body. So with 1,000, 10,000 over observation by Dr. Jennifer, okay, they always say that each ELT session, because of the depth that it can penetrate, is actually more effective than MLD, 8 to 10 times more effective. Okay, so depending on the stage you are, which category you are looking at, okay, of the cancer journey, you do about 1 to 2 sessions a week. Yeah, so it depends on what is the stage. Then usually our physicians will assess your condition before letting you know on the treatment plan. Okay, other than ELT, we also have this thing called the negative ion therapy. Okay, this is probably the single most powerful to complement our herbs as well as our acupuncture and all the traditional therapy that we have. Okay, so this medical device is from Japan, and it can generate up to 20 million negative ions. Yes, 20 million. Anyone of you think that 20 million is like a huge amount? Anyone of you think that 20 million is a really huge amount? Yes, okay, you have 20 million. If only I have $20 million. Okay, so 20 million is a huge amount. But compared to the number of cells in our body, which can run from 3 trillion and above, okay, so 20 million is now, it seems like a Chinese saying called 微不足道, but yet we need it. It is so necessary. Okay, so is this particular machine, okay, is used in over 400 medical institutions across Japan. Okay, we use it for cancer, we use it for patients with chronic conditions, we use it for our fertility as well. Okay, so why negative ions is important for our body? Okay, link back to the 3 key notes that I tell you earlier. Why is negative ions important? Okay, I know it's on the slide. Come, try. Let's see who managed to get it right. Yes. Okay, Dong got it right. Oxidation. Very good. Okay, so oxidation can trigger DNA damage. So we need to help the body reverse it. Okay, and one thing I like, because for those of you who have tried it before, okay, one thing I like about the wisdom of this doctor or this inventor is that, okay, one, he managed to make the machine send 20 million negative ions, so there's a huge amount. Okay, very good. But he knows how to strategically put, like strategize. He knows how to strategically place all these conductive plates on certain points on the body. Okay, so these points are actually our acupuncture points. Yeah. Okay, why? Because research have shown that acupuncture points have actually less electrical resistance. So we have less electrical resistance means these negative ions that are being released by the body, by the machine can be better absorbed by the body. Okay, so he placed all these points strategically across our body. So for cancer patients, we have specific 2 protocols. One is to strengthen your immunity as well as improve circulation. Okay, targeting strengthening immunity can help to reduce oxidation and then help to improve circulation to combat the stagnation. Okay, so it takes the body about 3 months, okay, to regenerate, grow new cells and all, because some cells will die, then you have young new cells coming up. Okay, so it takes about 3 months. So we usually complement these therapies as well as herbs, as well as acupuncture, depending on what is most suitable for the patient, okay, to help them feel better faster. And we recently have physician Lim, okay, another physician in our team, okay. So he actually has this cancer patient who managed to do multiple sessions of negative ion treatment, and she actually reported better sleep. It's something that she has been missing for a bit because of the pain management. Okay, so we are glad to be also the only TCM clinic, okay, to offer this treatment for our patients. So those of you who have been putting off complementing your TCM treatments with your Western medicine, because maybe the herbs are very bitter, you know, or acupuncture is very painful, okay, we can consider this and ELT, all these non-invasive therapies that will help your body fight oxidation. So let's do some recap. Okay, the first part, we talked about the causes of tumor mass and cancer. Okay, so there are 3 key points that we have shared there. Okay, in order to combat it, we need to reduce oxidation. Okay, improve qi and immunity, as well as reduce blood and phlegm stagnation. Okay, all these 3. Okay, quite easy to remember. They can be broadened into a lot of various different expansion and topics, okay, but this is the key ideas. And then Physician Low shared about the TCM support. Remember, just be a rabbit, okay? So rabbit goes for something that's clean and healthy, okay, with the herbs, okay, we have immunity with Huang Qi and Ling Zhi, and then we have dryness, to combat the dryness, okay, we have Shen Di Huang as well as Xia Ku Cao. Okay, so she also shared 2 teas that are very convenient for you to brew. And lastly, like rabbit, jumping, point, 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 point. Yes, okay, that is your rebounding exercise, because that helps to unclog your lymphatic system. Okay, and then I shared some tech-enhanced therapies as well, so that will all help to combat your whole overall body and improve your overall health. Okay, so maybe I can share with you one of the patients who tried all of the different therapies in our clinic. Okay, so we have Susie. So Susie retired in 2018. Okay, so she came by to us in 2019 because of a shoulder pain. So I asked her, hey, how do you get your shoulder pain? You know, then she was like, oh, last time I do admin, then you know the copier very heavy. So she was like, push up the copier, put in the paper, boom. Then okay, so the copier was very heavy, and she think that might be the reason why she injured her shoulder. Okay, so for her shoulder, okay, that's like, okay, can we do acupuncture, put in a few points, and then we gave her some herbs, but she didn't like the herbs, so we said, okay, why don't you try ELT? So ELT, because it's painless, right? So try ELT. So usually ELT can sense and because of the resistance that we talk about, right? It can tell you where are the areas of blockage. So because shoulder pain, naturally, your shoulder will be congested. But for her, it wasn't just the shoulders. Her whole right side of the body, yes, this whole area was congested. So we told her, Susie, you know, this is quite serious because usually it's just isolated area, but now this whole area is congested. You need to come back for more sessions. But because it was near Chinese New Year period, she was very busy. She was like, okay, I'll make an appointment after that. Okay, let me enjoy Chinese New Year. Okay, but what happened was that during Chinese New Year period, she actually saw that her nipple bled. Yes, her nipple bled again. The first time it happened was in 2018, near the end of the year. And it's the second time it happened. So she was like, okay, I need to do something about it. I go for a mammogram check. Okay, so with the oncologist, she did a mammogram. Boom. Okay, what happened? Is the visual, like you know, Milky Way, pop, 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 a lot of stars, okay, a lot of different small little bugs. So of course the doctor said that, hey, you know, this one looks like a great mess, okay, so we have to do surgery. So between the diagnosis and the surgery, it was about a month or so, okay, 3 weeks to a month. So during this period, then she decided to take more effort to reduce the oxidative stress. So she did ELT, she did acupuncture, she did herbal medication, she did negative ion. So she did a full-fledged. Okay, everything that can help her, she do. So when she finally did the surgery, okay, so she did surgery, the doctor actually managed to remove one main mass and another smaller one. And the doctor told her that, of course, the doctor didn't say like, oh, no, what happened? But the thing is that she was happy because in the end, it was actually contained. So all of these different treatments help to combat her issue, and help to reduce oxidative stress and improve circulation in the body. So to this day, she's also still doing all the different treatments available, okay, to help herself. Okay, so that's the reason why after that she gave us this really nice, sweet, testimonial. Okay, so she and on top of that, okay, she actually, like I said, if all of you who have been in the journey, okay, so do take note. There is something that you can change, which is your lifestyle. Okay, so what she did, she also changed her lifestyle. She eats a lot healthier. She goes out with her family and friends. They'll be like, oh, everyone's like, eating this and that. She'll go for something that has the less oxidation, that will generate less oxidation in her body. So kudos to her, okay, for doing all that she can to help herself, changing her lifestyle, doing different treatments that will help to boost her immunity. Okay, so if any of you would like to know more about how ORG can help you, or how Oriental Remedies can help you, okay, on your cancer journey, here is the time. Usually I won't say it for the other webinars and stuff like that, but for cancer patients, okay, our consultation will take up to an hour. Yes, up to an hour. Why? They're like, oh, you go see doctor very fast, chop out the door. But for cancer patients, okay, we really spend the time to understand their body constitution. Okay, we really take the pulse, see the ear, take the tongue, okay, then explain to them why are they having this, and then understand from them what are their next approach, are they going conventional or not. So there's a lot of things that you want to understand. So consultation is about an hour long. So regardless of which stage in your cancer journey that you are on, so we have a team of 7 bilingual physicians that will help you understand your body so that you can actually be on the road to recovery. So all of us graduated from NTU and then in China as well. So we have an average of 10 years of experience. So if you have always wanted to see a TCM physician, but maybe you don't know, like, I don't really understand the consultation. I don't know what they're talking about. Okay, so we pride ourselves in demystifying it for you. Okay, why? Because we want you to understand what is happening to your body. Okay, so in Singapore, we realize that, hey, a lot of people don't understand their condition. They don't understand what is happening in their body. They don't understand what the doctors are telling them. Okay, so we pride ourselves in demystifying it for you and to help you. So like I said, on top of TCM treatments that we have in the clinic, we also have all these tech-enhanced therapies that can help you feel better faster.
Okay, so that was a clinic in Singapore that, as we can see, combines the TCM therapy and some more modern enhanced therapies to improve lymphatic flow, to reduce negative ions, and to so basically so they can open better flow of qi and blood in channels. So we're going to take a 10 minutes break, and when we come back, we're going to look in additional video completing today's session. So I'll see you back in about 10 minutes. Thank you. Okay, so we're back. So we're gonna look at another video. So that's number 3 or 4. The 4th video, we're not gonna have a time to see it, in part because even the 2nd video is 2 hours in duration, so we'll probably see a half of it. Again, I curated these videos because it enhances the theory that we're covering today in the class. So please find some time, and if you can, go on links I left it for you in chat area, and watch these videos because it will add to depth of the lesson. So let's have a look at first half of this video, and then we're gonna conclude with that our lesson. Before we go into video, just to reaffirm, so today we'll look at an introduction to oncological theory, role of TCM in oncological care. We'll look at some common material medic acupuncture and moxibustion formulas for side effects caused by radiotherapy and chemotherapy, namely liver, kidney, nausea, vomiting, and others. And so next week, we're going to look at a treatment of complication commonly associated with the cancers. And that is a chapter 5 in our textbook. So we're going to look at pain, fever, jaundice, profuse sweating, hemorrhage, pleural effusion, ascites, menstrual disorders, constipation, and skin ulcers. So that's our focus for next week. Right after that, we're going to actually look into specific cancers. So September 20th, we'll look at nasopharyngeal and esophageal cancers. So let's now go back and look at this video first half that we have prepared for you on a YouTube. Okay, let's go the subtitles.
Don, and thank you to Yes to Life for organising this. I'm actually very honoured that they asked me to speak. I know that it's been a little bit time coming, but we finally got there. And today I'd like to talk about, I'd like to talk about quite a few different things. So I hope you don't mind. I'm going to kind of be surfing around a little bit, and hopefully by the end of it, it will make a little bit of sense in terms of my approach to this subject, and certainly the approach of our clinic to this subject. Before I move any further, obviously, this is very important here, right? We don't want to fall foul of the Cancer Act. Very, very important, and I'm notorious for putting my foot in my mouth. Can I check if this is on? It should be on. Yep, it's on. So, none of this presentation amounts to advice for treatment, right? This is purely my kind of take on the landscape of cancer at the moment, and Chinese medical concepts and Chinese medical theories around this subject. So a little bit about myself. First of all, I am the director of this clinic. Acumedic has been in existence since 1972. We're the oldest Chinese medical clinic in the UK, possibly Europe. I'm not quite sure, but I think we're there or thereabouts. And we offer Chinese medicine, acupuncture, herbal medicine, Tuina massage. We also offer other massage services as well. We've also got a skincare range called Sinensis, which you were all standing around just before. I'm also the director of Mayleaf Tea. Mayleaf is a tea company. We specialize in providing real, true, high-quality tea. And when I say true tea, I mean true tea. We source it direct from farmers, and it's real artisan tea, top-drawer stuff. And I'm also the chairman of the CMIR. The CMIR is the Chinese Medical Institute and Register. And this is an association, professional association for practitioners. We train GPs, we train doctors, we train healthcare professionals in Chinese medicine and acupuncture. We run diploma courses in association with Beijing University in China. So we're all about trying to integrate East and West and try to get doctors and healthcare professionals to learn more about the concepts of Chinese medicine. The CMIR is also involved as a kind of advocacy group. We are dealing a lot with the politics of medicine, of which I'll discuss a little bit today. So that's part of the role that I have there as well. I'm also, sorry, this is not meant to show off. I'm just giving you the whole list so you understand my background. I'm also chairman of the Chinese Medical Council. Chinese Medical Council is a council set up to bring together different Chinese medical associations to speak with one voice and to hopefully move forward and push integrative medicine. And finally, you'll be happy to hear, I'm vice chairman of the World Federation of Chinese Medicine. That's based in Beijing, and specifically for this committee, the Committee for the International Communication of Chinese Medicine, which is a very long-winded way of saying trying to push the language, trying to develop the language of Chinese medicine so that it's more palatable and more understandable to the Western clients. Who I am not. I'm not a Western medical doctor, and I am not a Chinese medical doctor. We have quite a few Chinese medical doctors working here. We have Western medical doctors working here. I would always defer to them in terms of knowledge, in terms of specifics. So I'm not coming to you from a medical background. I think it's very important that I make that clear. I'm not also a medical researcher officially, although I tend to spend my life in books and reading and understanding and trying to tease out the truth in various different areas of medicine. So what is my role? Well, to give you a little bit about my background, my father was a professor in Chinese medicine. So I've been brought up around Chinese medicine my whole life. I had acupuncture needles stuck in me from day one. And so I've been brought up in this environment of Chinese medicine. And I've been very fortunate in the sense that I have had an upbringing. My mother is from Switzerland, so there's been this real kind of convergence and divergence of East and West. And my whole kind of upbringing has been all about trying to figure out the differences in cultures and how that affects belief. And I think that it's something that is often overlooked and something that people don't really talk about, that people's idea of truth is so ingrained in their culture. It's so ingrained in what they were brought up to believe and what they brought up to think. And in many ways, it's invisible to us all, in the sense that we don't really know how much of that influence has affected our way of thinking. But the more we challenge ourselves, hopefully we start to understand the truth and we start to reveal different aspects of thought and different ways of looking at the world. So my father before me and now me, it's really about bridging East and West and bridging those concepts and trying to make that communication happen and make that, that dialogue happen to hopefully bring about new ideas and new thoughts. Oh, sorry. So it's all about trying to bridge those concepts. And one thing that I'm very particularly focused on is trying to break down dogmas. And dogmas is something that is a real kind of bugbear of mine and something being involved in the politics of medicine you see all the time. And I think that we need to kind of expose those dogmas and expose them so that we can hopefully bring ourselves to a more enlightened state. So quickly, definition of science, you all know it, but I just want to make it clear because the concept of science has in many ways been hijacked, and the idea of science has been kind of restricted to a very, very narrow field. But if you actually look at the definition of science, it's a methodology, it's a systematic study. It's basically being curious and constantly trying to question what you think is your own truth, constantly trying to question, things that you don't understand and question what people claim to be true. And question, seek out evidence from all different areas in all different ways. Not in a particular defined way, but trying to bring all the evidence together in order to bring about some sort of understanding of the world. And so this is done through observation and experiment. The difference between science and dogma is that dogma is a principle or set of principles laid down by an authority that is considered to be incontrovertibly true. And I think that this is one of the key things that I notice more and more as I involved in medicine and the politics of medicine, is how much dogma is creeping into medicine or is very much entrenched in medicine. And oftentimes the people that are espousing those dogmas don't actually realize they're dogmas, because the moment you realize they're a dogma, in a way it kind of breaks the myth, right? Because it's no longer something that you see the structure of, it just seems to be true. You've always been taught that this is true. And this brings me back to the concepts of culture and belief affecting your concept of truth. So we're going to try and break down a few of those today. So let's look at some of the prevailing medical science dogmas. Things are changing, and this is a really good thing, and there's a real movement and there's a real motion towards change, and I think that that's something to be encouraged. And so some of these maybe you will feel are actually changing, but they are, or they at least have been, really prevailing medical science dogmas. The first is the concept of science and materialism, the scientific materialists, as they're often talked about, which is that, you know, everything in the world is explained through mechanical, material, or chemical means, and that everything is either material, mechanical, or chemical in nature. You know, scientists that are studying consciousness are very, very few, right? Consciousness is the big mystery. Consciousness is, you know, the most incredible thing, and yet for many material scientists it's kind of considered an annoyance or an irrelevance, because, you know, you exist in your head, you're basically a machine, in essence, a machine which is your whole concept of life experience is chemical messages in your brain, and that obviously is something that doesn't sit very comfortably with a lot of people, and yet it's really something that's pushed. Material science is something which is dominating science, and if you read books, there's a great book called The Science Delusion by Rupert Sheldrake, which I recommend to everybody, which really tries to break down this concept of material science by actually really questioning everything that you thought was true. The other concept which has been a prevailing dogma in medical science is that we are essentially insular, that we're essentially closed off. Richard Dawkins' famous words, that we are all lumbering robots that are kind of somehow insulated from the world, and that our health is dependent on essentially internal factors in everything that we breathe or take in, but that our environment, or the concept of energy, or the concept of, you know, relationships, the concept of all of this other expanse of exogenous factors that are around us really needs to be explained purely in the basis of a chemical receptor that's brought in and somehow affecting our body, and that it can't exist in any other way. So the insular state is something that's a really prevailing medical science dogma. Similarly, the idea that body and mind are separate and should be treated separately, which is you know, a key difference between a lot of medical science and a lot of so-called holistic medicines. The idea that you know that there's no boundary between those two. So, you know, this is not just something that exists in medical science. It's a perspective issue. It's an issue of the individual considerations, and we'll talk a bit about that in a second. And finally, the big one, evidence. Everyone's talking about evidence, evidence, evidence. You need to show evidence of X, Y, Z. The unfortunate truth is that, you know, the medical science fraternity have a very, very narrow view of what is considered to be adequate evidence. And, you know, I debate this with doctors all the time and politicians all the time. But the fact is that, you know, RCTs, in all their glory and for all the good that they have done, which is great, is one piece of a puzzle and is not the whole story of evidence. And interestingly, David Sackett, who was the father of evidence-based medicine, actually predicted very early on in the 90s, I believe, when he was really pushing forward EBM. He himself was saying that he was scared that we would become tyrannized by the concept of external evidence, in other words, RCT trials, and that we weren't actually going to use all of the information that we're given. And hopefully we're starting to move more towards an outcome-based approach to evidence and an approach which is much more about real-world trials rather than simply randomized control trials. So those are some of the dogmas that I think are pervading in medical science. Deng Xiaoping, the father of modern China, he famously said it doesn't matter whether the cat is black or white as long as it catches mice. And I have a very similar approach to medicine. You know, a good medicine is a medicine that works. A good medicine is a medicine that achieves outcomes. The approach of integrative medicine, and you know, we are just one small piece of this integrative medicine movement. There are many of you probably sitting here, and many of them out there, is all about this. It's about saying, you know, this is not about dividing lines. This is not about saying this is better than that, or, you know, East is better than West, or, you know, drugs are bad and, you know, natural is good. It's not about that. It's about saying what works and what is going to help our clients without causing them as little side effects and damage as possible. And so my whole remit is medical research should not be dictated by dogmas. It should be open. And it should follow the other sciences in many ways, like modern physics, which is very expansive in their thought, very expansive in the way that they're looking at the world, and not afraid to kind of bring forward really radical ideas and explore them, because that's really where you will start to find much more truth. So, my last little tirade about the politics of medicine, and then we'll move on a little bit from here. But, you know, I do believe that we have a fundamental problem in our medical system, and it's a broken system. And the problem is that the people that fund research, that fund the regulatory authorities, for example, the MHRA is pretty much, you know, funded by the industry. The people that are spending money on lobbying, the people that have the influence to disgrace and shame other scientists, and have such a big influence on the entire educational system, are the same people that have an interest to selectively ignore any treatments that are not profitable to them. And this is just a crazy situation. And again, this is not about saying big pharma is bad. It's not about that. It's just saying that the system is set up in a really messed up way. I was trying to think of an analogy, and I actually couldn't think of one because it's so crazy that I don't think it exists in many other walks of life. But I guess it would be something similar to, I don't know, football agents, all of them owning a football club and then basically saying, well, we want you to choose our players. It's like, you know, it shouldn't be that way. It shouldn't be that the people that are basically have the power to choose what medicines and what therapies are researched have such a vested interest in those decisions at the end. And I want to make it clear that, you know, again, the idea that there are some kind of evil people kind of rubbing their hands together is I think, very simplistic. And there's an experiment that was done called the 5 Monkeys experiment. Does anybody know this experiment? The 5 Monkeys experiment is a really interesting experiment in behavior. So the 5 Monkeys experiment is this. You take 5 monkeys, you put them in a room, and then you give them a ladder or some stairs or whatever, and you put bananas at the top, a bunch of bananas. Inevitably, they all go up to get the bananas, right? As soon as they do, you blast them with freezing cold water from a hose. So you really make them shocked, and they run away and they scatter. And they continue to try to get the bananas, but you always give them the hose every time they do. Right, so they become conditioned not to do a certain thing. Then you take a monkey away and you put a fresh monkey in, a new monkey in. And that monkey will see the bananas and start to go up. And the other monkeys will beat that monkey up. The other monkeys will stop that monkey from going up there and getting the bananas because of the fact that they know that they're going to get hosed. And you can slowly take away monkey after monkey until you are in the bizarre situation where you have 5 monkeys that have never been hosed ever, and yet none of them will go up and touch the bananas. And I think that this is a really interesting kind of concept in the way that people are conditioned, in the way that we're all conditioned. That if you have enough of a stick to bash people, you know, and that punishment filters through a culture. That punishment filters through a thought process, and you know, you become conditioned in a certain way to either do something or not do something. And so I think the 5 monkeys experiment is an interesting one. Famous scientist Jacques Benveniste was somebody who was bashed, and you can see his quote here: "Salem witch hunts will kill science. Science only flourishes in freedom. We must not let fear, blackmail, anonymous accusation, libel and deceit nest in our labs." And I think that there's a lot of scientists, you can reel off a whole list of scientists that have had this treatment, including Nobel Award-winning scientists that have had this treatment. When they start to step outside the boundaries of material science, they are punished in some way by the industry. So let's move to Chinese medicine, and let me give you a little run through, and it will be very brief, about the kind of theory of Chinese medicine, or some of the theories of Chinese medicine. So first of all, Chinese medicine is a medicine based on thousands of years of observation and experimentation. And you saw the definition of science before, observation and experimentation. And I would quite happily argue with anybody who wants to say that Chinese medicine is not based on science or not scientific in any way. It's developed over time. Now that doesn't mean, as many materialist scientists say to me, oh, just because it's old doesn't mean it's true. Of course, accepted. But it means that there's been a lot of information that's been gathered in a very systematic way. And what's happened is that they've developed a system of medicine combining a number of theoretical modalities. And you've probably heard of quite a few of them. You may have heard of Qi, you may have heard of Yin and Yang and 5 elements. There are others, but we're going to, you know, just brush the surface here a little bit, okay? So Qi, 5 elements, and Yin and Yang. You've probably all heard about these at some point in passing conversation, or you've seen these things mentioned. So you work on those areas together to bring about healing. Now, as part of my role for the World Federation of Chinese Medicine Societies in the international communication of Chinese medicine, you know, what I am trying to bring about is a change in the language. Because, you know, Chinese medicine has this history, it has all of this knowledge, but it's still being framed in a very old language way. The language that's being used to describe Chinese medical theories, and the language which continues to be taught in Chinese medical universities, is a language that was developed you know, hundreds, if not thousands of years ago, by people making observations, right? And so what they were doing is looking at observations, seeing patterns that they could recognize, and trying to give those things names. And so the terminology which is used in Chinese medicine can sometimes seem very esoteric, can sometimes seem very kind of a little bit out there, it doesn't have to be that way. And I think that Chinese medicine, just in the same way as Western medicine, has to respond and has to break down any particular dogmas within Chinese medicine, and has to develop and modernize. So, you know, I'm a great advocate for Chinese medicine not strictly adhering to ancient interpretations of health. You know, again, black cat, white cat, it's about what works. It's about trying to figure out what is the right interpretation. The language needs to be changed to avoid confusion and to avoid ridicule as well. You talk about, you know, excess heat, you know, damp rising, you know, pathogenic qi, and all of these things that, you know, you speak to an average person on the street in the West, and they'll kind of look at you with a little bit of a funny kind of quizzical look. So it's about changing the language, and that's obviously a very difficult process when something is so entrenched to try and do that. And there has to be more evidence gathering, and this is something that we're involved with. I know Rob at Alliance for Natural Health is involved in it with us, and all things about gathering outcome data, gathering evidence, because, you know, like it or loathe it, you know, RCTs are here to stay, and we, you know, have to find a way to demonstrate the effectiveness of our medicine, rather than just individual anecdotal quotes from patients that were miraculously cured of certain things. It's all about trying to build up big data, and so that's what we're trying to do as well. So, given that, let's go through some of the concepts and just try to briefly touch upon them. Qi is a very commonly spoken about concept, and you'll often, if you see a doctor in Chinese medicine, they'll often refer to it as vital energy or the life force, or all of these different very kind of hard to pin down concepts. But energy being one of the most commonly used one, because energy is a kind of catch-all for lots of different things. But really, when you actually look into the text and you look at you talk to Chinese doctors and you talk to them and you try to kind of ask them the questions of what are you actually meaning by Qi. In my interpretation, and I have a doctor here who's probably going to smack me on the head and say that that's not true, but my interpretation is much more about looking at Qi in a different way, to look at Qi as a collection of energetic, mechanical and chemical in order to make an abstract construct. In other words, the ability or the function of something. So you have something in Chinese medicine like thoracic qi. Thoracic qi is the qi of the thoracic region. And it involves lots of different things, and the Chinese medical doctors will talk about how it moves and all the rest of it. But at the end of the day, it's more about talking about the abstract concept of all of its functioning ability. So the meridians, which you've probably seen lots of models with the meridians drawn on them, which again, modern science is starting to unpiece, and you're starting to see really interesting maps which map very closely to the meridians. That's a whole other discussion. So the bridge is starting to happen, but really the concept of Qi, in my approach, or the way that I'm looking at it, is ability. And that's how would you describe ability? If you took, say, Usain Bolt, and you said, what's his ability? Well, his ability is made up of lots of different things. His ability is made up of his, training, of his natural body mass, of his, ability to do X, Y, Z, his, things that he can control, things that he can't control, and wrapped up together, it's the concept of how well something is functioning. So when somebody talks about liver qi deficiency, they're talking about, the functioning ability of the collection of functions related to the liver. So when you talk about abstract concepts like qi, think about abstract concepts like ability and love. It's more about a collection of lots of different things that are very hard to pin down in order to come up with one word that describes it. What is yin and yang? Well, you've probably all heard of yin and yang, and you've certainly you've all seen that symbol. It's become one of those things that every Chinese medical clinic throws on their door. But yin and yang is a very far-reaching concept. It's the concept of opposite and contrary forces that are actually interconnected, interdependent, and complementary with each other. And you can see this throughout nature and throughout the world, that there are interdependent opposites that actually require each other in order for them to exist. And if you apply that to medicine, then you are basically taking the concept of homeostasis, which is a very well-known concept in Western medicine, but you are expanding it to include your individual type, your lifestyle, your environment, and trying to say, well, there's a balance that needs to be achieved not just internally, but externally as well, and those external factors have an impact on your health. Whether it be a balanced diet, a balanced work life, a balanced relationship, whether it be the ability to manage your time so that you're not overworking or being lazy, that you're not too sedentary or you're not over-exercising. It's about trying to achieve that balance throughout your life, and I think that that's just very common sense. Everybody kind of understands that concept when you put it in that way, that you throw a yin and yang symbol in front of them and they're like, oh, I'm having to buy some sort of very ancient esoteric concept. It's not that. It's just a very simple thing. Keep your life in balance, because if you don't, then it's going to be very hard for you to get back to balance, and that will affect your health in some way. Finally, we'll talk about five-element theory, which again would need days of, there are many courses on five-element theory of learning, but essentially it's again these ancient masters, and I do call them masters because I'm continuously astounded at the insights that they managed to develop just by observation, that in general there are, they've seen in nature that there's a kind of interaction, there's an interactive process that happens in 5 elements. So in the case of 5 minutes here, wood is burnt to make fire, fire becomes earth, earth turns to metal, metal mineralizes water, water creates wood, but then you've also got the opposite, so water puts out fire, metal will cut wood, etc., etc. So you take a concept, you take a construct, you start to notice things in nature and you say, okay, this is happening in a lot of areas of nature. Maybe this is happening within our body, maybe this is happening within our lives, maybe we should look at this and figure out if it assists us in any way to make diagnoses or make treatments. And it's interesting, and this is a real cultural thing, I think. It's interesting that in Chinese medicine and in Chinese culture and Eastern culture in general, there's a lot of this kind of creation of patterns, this creation of concepts. And when they're not useful, they don't use them. And when they're useful, they do. And that doesn't necessarily mean that they're kind of not... It doesn't always have to be that there's one way of doing something and that's the way it's done. You find the right way, you use the correct pattern that's going to work for a patient. So it's a different way of looking at the world. It's a different way of looking at treatment. It's about saying there are these patterns. There's yin and yang, there's qi, there's this 5-element theory, and there's lots of other theories as well. And we're going to try to work on which is the right one to use for this client. So oftentimes there are organs, and we'll talk about organs in a second, Jiangfu organs, that are associated to different elements. And so if there's a certain wood element, then and it's depleted, then you will treat the mother element. So you're looking distally, you're looking to treat at distance in the same way that acupuncture treats at distance through the meridian. So you may have a headache, but you'll have acupuncture needle stuck somewhere else because it's all about treating at distance rather than approaching directly. So this is another concept in Chinese medicine. So given all of those things, yin and yang, 5 elements, qi. Anybody who starts to work here, we have a kind of phrase here, which is like, we need you to become qi conscious, which is basically you need to kind of get out of your mindset of the material world, of materialism, or at least of this kind of very mechanical and chemical way of understanding anything and everything. And you need to start to look at these concepts of, how your external affects your internal. And the concepts of qi, the concepts of movement, the concepts of dynamism. And if you apply that to everyday life, then you start to recognize the importance of lifestyle. Because lifestyle is not something that is a choice that doesn't affect you internally. And I know that that is logical to probably each of you, but actually it's not really ingrained in medical science very much. So, air, breathing properly, getting fresh air. Breathing is one of those things that everyone thinks is kind of a natural thing that we all do, right? We all survive and we're all breathing. But how many people are actually really conscious of their breath and really training their breath? It's the same thing as anything in life. Yeah, you can naturally do it, but can you be good at it? And so, breathing is a really powerful, life-changing thing if you really focus on breath at any point during the day. Sometimes you say, take 5 minutes. I can hear some breaths going. This is good. It's about recognizing the importance of, bringing in air. But in Chinese medicine, they would say you're bringing in not just air, you're bringing in energy, you're bringing in external qi in some way. Diet, obviously important. We all know about vitamins, nutrients. We all know about the chemicals within certain plants and good things to eat and bad things to eat. And we can talk about that. And we've got a nutritionist speaking next week who will probably give you lots of really amazing information about that. But also look at it in terms of the energetics of food as well. And in Chinese medicine, they look at food in many different concepts of hot, cold, things that cause damp, things that cause you to dry. There's all sorts of elements that are brought in that when you combine it together with the nutrition and the kind of chemical side, actually there's amazing links that are happening, and you start to realize how these guys guys and ladies, I should say, in China, really actually were quite ahead of their game in terms of their thought, and the patterns that they saw actually do ring true many times. Exercise, very important. Qigong is the ultimate example of that. You know, being able to trying to build and move qi for health through prescribed movements. But exercise, as we all know, is very, very good for you in moderation. Remember, yin and yang, you can't do anything in excess. You talk about things like bad backs or, bad shoulders and bad posture, and, we're all sitting in front of the computer or we're all looking at our phone all the time, and, this is causing a lot of problems. And you can look at it in terms of lots of different things, but the Chinese would also look at it in terms of the flow of qi. If you're hunched up, then blood is not going to flow properly, and therefore qi is not going to flow properly through your meridians and through your blood vessels, and that's going to impact and cause stagnation, which is going to potentially lead to problems like pain and stiffness. External factors, as simple as the weather. We all know that we're more likely to catch a cold in the winter than in the summer, right? But it goes further than that, and different people are suited to different conditions. Temperature, hot, cold. We all know people that are cold all the time and people that are hot all the time, and how that relates. And so you have all these theories that have been built up in Chinese medicine to explain that too. And also, finally, the psycho-emotional state. The concept that your emotions are not separate from your body, that your emotions have a major impact on your health. This is constantly being borne out, right, in medical studies, that your happiness, your sadness, anxiety, depression. One of the big things about cancer in general is the whole fear, the culture of fear which is spread around cancer, which is not necessarily a helpful thing to spread, because all you're doing is further impacting people's lives in a negative way. And we also know people that exhaust us, right? There are some people that you just can't be around for too long because you're going to be exhausted. And there are some people that give you energy, and you walk out of a room with them and you feel like, wow, I feel like I'm ready to really, turn a new chapter in my life, or I've got, a new sense of motivation. I've been given energy. And again, in Chinese medicine, this is all explained in the theories of qi. It's all explained in the theories of how your environment affects you, how energy of other people affect you, and you may need different things at different times in your life. So all in all, Chinese medicine looks at your internal health, looks at your internal balance, factors in as much data as they possibly can about your lifestyle, your history, everything, which is why if you go to a Chinese medical doctor, you will tend to have a good half an hour where they're asking you the most seemingly bizarre questions, because at the end of the day, they're trying to dig deep into understanding your whole internal and external environment in order to start to try to get an understanding of symptoms that you are experiencing. If you do go to a Chinese medical doctor, what you will experience is you will have a whole process where you'll be questioned, all sorts of questions that you may think are completely irrelevant to the symptoms that you have come exhibiting. They will observe, and a lot of the time, a lot of the training that is given to Chinese doctors is this kind of observation, which is done without your knowledge, all the way from smelling to listening to the way that you speak, and it's all about trying to assess, various different patterns. They're trying to understand, how all of these things relate to your current condition. Tongue diagnosis is a big thing. So the idea that you can get a good idea of somebody's internal state of health through their tongue and through their pulse diagnosis, which is a very complicated thing. Then underneath that little black cloth, you can reveal it. There's a little machine to test different pulses. And finally, looking at Western diagnosis as well. So, integration is the key here. We don't want to just ignore, Western medical science has lots of data that can assist a Chinese medical doctor to make a diagnosis. And the diagnosis tends to be a syndrome diagnosis. A syndrome basically means a collection of symptoms, which in Chinese medicine, they've grouped together and go, well, those symptoms kind of usually belong together if you suffer from a certain syndrome. So it's about, again, looking at patterns. Quickly talking about Jiangfu organs. If you ever go to a Chinese doctor and they start to talk about liver qi stagnation or rising qi in your kidneys or whatever it may be, they are not talking about your anatomical organs, okay? They're not talking about your anatomical organs. They're talking again about what these, and this is why the language needs to change because it's so confusing for so many people. They're talking about, you know, these, a collection of functions that are associated to an organ. Okay, so in the example of kidneys, the kidneys function is to help excretion, but it also relates to sexual function, relates to lots of other functions as well. And so, you know, when they're talking about your kidney, they're not just talking about your anatomical organ, they're talking about a lot of different things. So Jiangfu organs is a collection of physical, emotional, and psychological functions grouped together as a function, and the ancients gave those names to organs, which was unfortunate because it's causing a lot of confusion, which is why we're trying to change the language. So if you ever go to a Chinese doctor, make sure you understand that. And finally, as I said, syndromes basically is a collection of symptoms which have been observed to be interrelated. Again, through thousands of years of observation, they start to say, oh, interesting, if you have that symptom and that and that and that, and you're experiencing them together, then we bunch it into a certain syndrome that we can then treat. You may have the same symptom, but if it's not in combination with that symptom, then we're going to bunch it with this syndrome. And so this is how Chinese doctors will take the same symptom being exhibited, but treat it in many different ways because it's being done according to syndrome differentiation rather than simply kind of symptom bashing. It's about trying to kind of piece together all the different things, which is again why they ask you lots of questions, because they're trying to kind of, so it's detective work. It's trying to work out which syndrome or syndromes you are suffering from. Okay, so in Chinese medicine theory, the simplistic model is they look at your predisposed personality, your predisposed body type, combine it with your lifestyle and your environment, combine it with your mental and emotional state and your physical condition, so all of those together, not just physical condition, and they then try to get some understanding of the symptoms that you are exhibiting. Oops. So let's look at those dogmas that we saw before and look at how Chinese medicine conflicts with those dogmas. And again, things are changing. There's a real kind of shift which is happening, which is really encouraging to see. So the idea of materialism, well, in Chinese medicine, material, energy are the same thing. And this is, again, modern physics. It's not so modern anymore, but this is something that has been known in physics for decades now, that, you know, the separation of material and energy is in many ways an irrelevance. Insular, the idea that, you know, we are the lumbering robots of Richard Dawkins. In Chinese medicine, your health is affected by not just what you take in, not just the chemicals that you breathe in or you eat, but is affected by the people around you, the job that you do, you know, your obviously things like sleep patterns, your relationships, all of these things are going to affect your health in some way. And you know, the relatively new science of epigenetics is now starting to look at how gene expression is being changed by your environment, and that's just one example of how science is starting to move on similar platforms to the ancient ways of thinking. The separation of mind, body, and spirit, that's, again, something that Chinese medicine just doesn't do. It's all part and parcel of the same thing, and you can see, you know, psychosomatic, you know, the evidence that your mind can affect your health. You look at placebo effect, which is something which is continuously being used as a stick to bash medicine, but in fact, it's one of the most incredible effects around, and it should be something that should be funded. It should be something that we spend billions on to try and understand the placebo effect, to try and understand how just through thought and through belief we can affect our physical health. That's an amazing concept, and yet it's kind of considered to be an annoyance, something to beat in a randomized controlled trial, and placebo is getting stronger. Right? So it's harder and harder to beat those placebo effects. And there's also nocebo. You can see that the opposite can happen. And finally, evidence. Chinese medicine we could talk for hours about why Chinese medicine doesn't do RCTs, or why there are fewer RCTs in Chinese medicine. There are, probably in the over, I think it's 70 or 80,000, so it's not like there aren't any. But essentially, you know, really what's happening is that it's a very, very difficult box to fit this medicine, personalized treatments, difficult to create placebos, lots of different reasons. And really we should be looking at using RCTs where necessary and using outcome-based evidence data as much as possible. Because really, at the end of the day, that's what matters. Did it help people? Rather than did a certain number of people achieve significance that could be repeated. And so there is a move, and the politics of medicine is moving towards outcome-based medicine. And that's something that, you know, we are encouraging. Okay. So my big thing is perspective. And I seem, any speech that I give, I tend to kind of talk about this. And the idea is that, you know, East and West thinking is the primary difference between East and West thinking, and I'm not just bundling East and West, it could be holistic versus, you know, material science thinking, is the concept of perspective, the idea of the Newtonian way of looking at things versus the quantum way of looking at things. Both are right? It's not about right or wrong. It's about what is going to be the most useful at any one time, right? We all know that our position as an observer affects reality. Where we are looking at something is going to affect not just its reality to us, but it's going to actually change its reality. So you look at light, you look at all these different things in quantum mechanics, and you can take that perspective idea and you can filter it out ad nauseum to almost anything, and we're going to do it with cancer a little bit later. But you know, the idea of a reductionist model versus a holistic model, the idea of a microscopic way of looking at the world versus a macroscopic way of looking at the world, and really, you know, again, it's not about, both are correct. You know, it's about choosing the right one, or ideally trying to put them all together to create a whole sense of truth. And I've written down here wine and tea for those of you who know, probably not many of you do. I am a real tea obsessive. One of the things about that I find really interesting is the Chinese invented a lot of things, right? We know the list. If you go to Wikipedia, they invented a lot of things. One thing they didn't invent is glass, right? And the reason why they didn't invent glass is because they drank tea. Tea you drink usually in porcelain. Now it's changing, but you drink in porcelain or you drink in clay. The West, you know, like their wines. And so glass developed much more in the West. And so lenses could be developed in the West. Now, Chinese history in terms of lenses, telescopes, microscopes, it's very, very limited. And so they were forced to look at the world from a macro way, right? They were forced to find truth by stepping back, looking at patterns. Whereas, you know, in the West, we had, you know, lenses we could start to zoom in and try to find truth in detail. And again, both are right. It's just about not being fixated on one perspective. It's about trying to create a whole. One of the classic things is how to paint an elephant, and this is again a theme which I talk about a lot, which is, you know, my father always used to say to me as a kid, how would you paint an elephant? And I would say, you know, what do you mean? And he'd say, well, do you go close? Do you paint the detail of the skin, or do you step back and draw the shape, you know? And that's a very simple example of, you know, this concept of perspective. Which one is true? Which one is more accurate? They're both accurate in their own way. They just are presenting a different angle or a different position of observation. Okay, finally, half an hour later, 45 minutes later, we get onto the subject in hand, which is cancer. And what I'm going to do is I'm going to try to go through some of the Western thinking of cancer and go through some of that in order to set a base for me to compare it to the Chinese medical thinking. So I apologize if you know some of this already, but I just think it's worth going through it. So Weinberg and Hanahan's traits of cancer cells started off, I think, with 6 and now has expanded to 10. But these are some of them. Self-sufficiency in growth. In other words, the accelerator pedal is on. that they evade growth-suppressing signals, that they are resisting cell death, apoptosis being the main concept of cell death. The ability to evade the immune system is a relatively new one, and is something that I think is a bit controversial because there's a real belief that your immune system can attack cancer, and that it doesn't just evade it. And it's not an inherent trait of cancer cells, which is why I put my own personal question mark on that one. And that kind of relates to the concept of immortality, the idea that the cell cannot die. Cancer doesn't want to die. Enable replicative immortality, induce a blood supply, angiogenesis. Angiogenesis, for those of you who don't know, basically means that the cancer cell is throwing out angiogenic factor to try and build up a blood supply in order for it to feed and also potentially to spread. And a lot of drugs and a lot of therapies are looking at trying to combat that. So anti-angiogenesis is something that is found in a lot of herbs, and we'll talk about that later. So you can see how some of the herbs can affect or inhibit angiogenesis. The ability to spread to distant sites, to metastasize, and this is again a relatively new one, promoting inflammation, which then allows it to damage cells around it and spread further. So this is the concept of growth and replication. Finally, you've got the reprogramming of the energy metabolism, which we'll talk about a little bit later, and the famous genome instability, the mutations that are happening within the DNA. And these are the areas that are looked at, in terms of framing potential causation for cancer. So the SMT theory, the somatic mutation theory, which is the prevailing theory and continues to be the prevailing theory, although again things are changing, is that you have a cell that is affected by a carcinogen or an oncovirus in some way, and that causes multiple mutations to the DNA at particular oncogene sites, which then leads to cell proliferation and this uncontrolled proliferation. And the mechanisms to evade cell death develop, and there's this genome instability and an altered metabolism. So that's the somatic mutation theory. Again, I apologize if you know all this already, but it's worth going through it for those that don't. The Cancer Genome Atlas was the big, the big thing, and it was a huge project to basically find a cure for cancer by uncovering and exposing the main genetic mutation sites on DNA, which then they could target to try to find drugs which can help to cure cancer. And this has been going on for many years. And the problems with SMT is that it was way more complicated than they imagined in terms of the number of mutational oncogene sites. There were hundreds found, and it made the idea of targeted drugs a much more difficult concept to get their head around. Also, one of the key things is that TCGA demonstrated that there was heterogeneity between, first of all, between different people suffering from the same cancer. So in other words, the mutation sites were different for anybody suffering from any particular cancer. There were differences between them. Also, intratumoral, so within an actual tumor, there was differences. So how it's very difficult to create targeted drugs when even within a particular tumor you have this variation in the mutations. So what markers are you using in order to direct your drugs? And intermetastatic, so once the cancer had spread, that at different remote sites in your body, again, it was different. There was differences, but there are differences between the mutation sites. And this basically, combined with the belief, and I don't know enough about the science of it, so I'm not going to go too deep into it, but there is seems to be a consensus that the idea that these DNA mutations are spontaneous, if you look at the rate at which that would happen, it's very, very, very low compared to the incidence of cancer. And so you've got these three things that kind of send a little bit of an alarm bell to anybody studying the SMT theory, because it kind of demonstrates that there's a lot more complexity, that the targets are continuously moving, that the gene sites are not some stable, nice pattern that we can create easy drugs for, and that actually the whole concept of the DNA mutation rates are very different from the actual cancer rates. And so what...
Okay, so we're going to stop here. And so there is quite a lot here in this video, which is really exciting, and it shows you Western and TCM view on treatment and theory behind the cancer and tumors. So you have all the links, and we're going to continue next week at looking at side effects of the cancer treatment that we are usually involved clinically, treating patients who are undergoing various forms of therapies addressing the cancer itself. So I just want to thank you all for being part of today's class, and I'm looking forward to see you next week. This class is recorded, so you can at any time contact our academic office and access this class as any future classes in this course. Of course, culminating with our final exam that we'll talk about it a bit later toward a last theory class before that. So thank you all, and I'm going to sign off of this class today. Bye, everyone.